Siapa lagi ada? Ada Prof apa? Ada. Kita tak nampak apa. Muat tak pasang kamera apa.
Tak voice je.
Dah, voice dah. Dia tak cakap apa-apa.
Bu, bikin yang lagi. Yang macam. Apa saja lah, kalian nggak akan bikin, Mem. Oh, klik kanan.
Kita nak cakap. Hello, salam. Kita tidak dengar ya. Kita tak dengar MC.
Ya, Prof. Sebentar, Prof. Soon akan dimulai, Prof.
Dah muted. Okey. Sekarang baru dengar. Oh, maaf, masih lagi tidak dengar. Dia muted lagi lah. Masih muted masih tidak dengar, maaf.
Yes,
Tak
Prof.
dengar.
Ya.
Sensitif tu dia. Boleh dengar? Sekarang boleh dengar?
Sudah, Prof.
Okay, alright. Tapi ibu tak ada mute di sini. Kalau ibu mute, dia situ automatik dia mute. Okay, ibu kena on ya tak? Tak ada, okay. Okay, tak apa. Kalau tu something kena masuk ni. Sebab dia kata komputer ni. Apa cara dia? Dia mute. Kalau ibu mute. Okay.
Ini welcome to the other participant for Mr. Vinay from Laos and also Mr. Maslan and then the other participant. And also greetings for the other participant from some province in Indonesia, and also for student of STKS Mitra Husada Medan, and also the other speaker from Lincoln University, and also from Masa University, and also from Laos, and now still wait from Nigeria, Dr. Ahmed Abubakar.
Unmute, please. We cannot hear.
Okay, sir. Thank you.
Mr. Eddie, unmute. We cannot hear.
Okay, sir. Good morning, ladies and gentlemen. Please welcome the first Mitra Husada Health International Conference, June 29 until 30, 2020, Medan, Indonesia. Good morning, ladies and gentlemen. The Honorable Dr. Sandeep Poddar from Lincoln University College of Malaysia. Welcome, sir. The Honorable Prof. ZAHRAH from Mahsa University. Welcome, Prof. The Honorable Dr. Abubakar Ahmed from Kwara State Ministry of Agriculture, Nigeria. Maybe will join soon. The Honorable Dr. Sounthone Phothisane from Savanaketlau College of Health Science will join soon. The Honorable Madam Siti Nurmawan Sinaga from Institute of Health Science Mitra Husada Medan. Welcome, Madam. And also the lecturer, speakers, and seminar participants. Firstly, let's say thank to our God who has given guidance, happiness, healthy, and mercy, so we can meet and participate in Zoom and YouTube in this special event. We proudly present Webinar International, the first Mitra Husada Health International Conference 2020, with the theme Emergency Management COVID-19 of Reproductive Health for Saving Life. Ladies and gentlemen, here we are, Edi Marjuang Purba and Julkarnain Batubara. As the master of the ceremony, will guide this Webinar International today. But before starting our agenda, let me explain this agenda schedule of this Webinar International. First agenda, welcoming and greeting. The second agenda, opening prayer. The third agenda, sing the national anthem of Indonesia Raya. The fourth agenda, welcome speech and greeting from the Chief of College Tikes Mitra Husada Medan, Madam Siti Nurmawan Sinaga, and the fifth plenary session by speaker. Ladies and gentlemen, now we are going to the second agenda, is opening prayer that will be delivered by Mr. Julkarnain Batubara. For Mr. Julkarnain, time and place is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Ladies and gentlemen, I will guide this prayer based on the teaching of Islam. And those who are not Muslim, you are blessed to pray according to each your beliefs. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asrofil anbiya wal mursalin wa ala alihi wa sahbihi rasulillahi ajmain. Oh Allah, Monday, June 29, 2020, in this beautiful place, we gather here to bring about a webinar international, the first Mitra Husada Health International Conference. The theme is Emergency Management COVID-19 of Reproductive Health or Saving Life. Make this webinar international conference as a useful science assembly, as a medium of sharing useful ideas, knowledge, and experiences of scholars, researchers, and students of various disciplines. May the conference we organize today benefit to our lives, broaden our knowledge, shine our ideas, and lead us to be successful, productive person, which in turn will burst the dignity of our nation. Oh Allah, protect us from unintended temptation, show us the right path, and give us knowledge and strength to perform good things. Equally, show us, make it clear, and the bad things, and give us knowledge and strength to avoid them. Oh Allah, you are the one who can fulfill our doa. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Mr. Zulkarnain. The third agenda, sing the national anthem of Indonesia Raya. We invite all audience, please stand up. All participants sit down, please, again. The fourth agenda, our welcome speech and greetings, will be delivered by Chief Institute of Health Science Mitra Husada Medan for Madam Siti Nurmawan Sinaga. Time and place is yours.
Good morning, everyone. Let me introduce myself. My name is Siti Nurmawan Sinaga, as the Chief of College Stikes Mitra Husada Medan, Indonesia. The Honorable Dr. Sandeep Poddar from Lincoln University, College Malaysia, Good morning, sir. And also as Senior and Research Director, the Honorable Prof. ZAHRAH SAAD from Mashhad University and also Dean Faculty of Nursing and Midwifery. Good morning, Madam. The Honorable Dr. Abubakar Ahmed Tijani from Kwara State Ministry of Agriculture, Nigeria, and also Kwara Rapid Response Team COVID-19. The Honorable Dr. Sounthone Phothisane from Sapanakat, Laos College of Health Science, and also the lecturer, speaker, and seminar participant. First of all, let's say thank our God who has given us happiness and health so we can meet the participate in Zoom and YouTube in this special event. We proudly present Webinar International, the first Mitra Husada Health International Conference 2022, with the theme Emergency Management COVID-19 of the Reproductive Health for Saving Life. The first conference of STIKES Mitra Husada Medan is very important activity because it is a forum for lecturers, students, scientists, participants, both from domestic and abroad, to share and discuss the improved health status, especially during COVID-19 pandemic and new normal also been started by several countries and regions. The theme in the conference was Emergency Management COVID-19 and Reproductive Health for Saving Life. This theme is based on the co-pandemic period. Reproductive health is certainly affected because the number of visits to health facilities, hospital, health centers, and clinics has decreased due to trauma. This is caused by the transmission of COVID-19, which is quite common in health facilities. This conference is one from activities in achieving the vision of STIKES Mitra Husada Medan, namely releasing STIKES Mitra Husada Medan as the Center for Science and Technology Development in the field of health that excels in excellent service with high integrity and competitiveness at the national level in 2020. In addition, this conference also encouraged because the application of feature value is in STIKES Mitra Husada Medan. P is for professionalism. To be a professional in providing health service in the new normal period, we must have commitment, responsible, the honesty, and thinking systemic. A is for accountability, able to make the right and the correct choice when conflicts in interest occur between interests of public sector and personal. C is for collaboration. Is the fundamental process and cooperation that breeds truth, integrity, and breakthroughs, achieving consensus leadership in all aspects of the organization. A is for empathy and compassion. Can feel what is felt by others so that they maintain their own health and not increase the risk of the other people. And R is for reliability. Through this value, STIKES Mitra Husada Medan is commitment to improving the quality of graduates who are competitive and international standard. On this occasion, we are very proud because of the enthusiasm of the participants of the conference, because until the last day of the registration, there we are as many as 8,000 participants who registered from a target of only 2,000 participants. For that, STIKES Mitra Husada Medan will be commitment to provide the best service during this webinar to all the participants and colleagues involved in this conference. Lastly, I want to say welcome to the first Husada Mitra International Health Conference 2020. Thank you very much. Thank you.
Thank you very much, Madam, for welcome speech and greeting for us. Ladies and gentlemen, those are the agenda we have presented to you this morning, as we have finished our opening ceremony. And now we are going to presentation session from our keynote speaker. Ladies and gentlemen, for the first keynote speaker, Dr. Sandeep Poddar from Lincoln University College, Malaysia, with the title COVID-19 Depression and its Effect. The keynote speech will be moderated by Mr. Zulkarnain Batubara. For Mr. Zulkarnain, time is yours.
Okay, thank you for Mr. Eddie. Before we start our presentation, I would like to read curriculum vitae of Dr. Sandeep Poddar. Dr. Sandeep Poddar, he is Senior Research Director and Executive Editor Publication, member of Board of Studies, Lincoln University College of Malaysia. He has been graduated from University of Calcutta in 1993 with honors in zoology. He has obtained postgraduate diploma in dietetic from All India Institute of Hygiene and Public Health in 1995. Master of Science in Zoology with specialization in biochemical genetics from Dayak and Educational Institute 1998. With distinction, he has completed PhD in Zoology from Pakpahan Institute of Medical Science in Cytosociety in 2004. After completing PhD, he pursued postdoctoral research in different projects on hemoglobinitis and oral cancer of mutation. He has published several research papers, filed patents, and organized international conferences, and also edited books in Malaysia and India. Dr. Sandeep is founder assistant secretary of Dr. Tarak Nath Poddar Memorial Foundation, Calcutta, India. Ladies and gentlemen, for participants, if you have a question for keynote speaker, please write in chat room Zoom. We will collect and ask for the speaker. I would like to welcome Dr. Sandeep Poddar. For Doctor, time is yours.
Thank you. Thank you, Mr. Zulkarnain, and thank you, Mr. Eddie. I first like to acknowledge upon Siti Nuraman Sangya, the invitee and guests of who invited me for this speech, and also the other speakers, Professor ZAHRAH and others. So without wasting much time, I would like to present my slides. Today's topic is on emergency management, or today's webinar, emergency management of COVID-19 of reproductive health for saving life. So it is organized by SKY's Mitra Husada, and I am talking on a different aspect of this health on emergency management in COVID-19. I am talking about COVID-19, depression, and its effect. As we know, depression, what is depression? Depression in weather means some hot water with air coming, and there is a storm and there is a rain. Then the depression is over. So it is a weather depression. And in this condition, we have to relate this our depression, how we can relate it with this weather depression. So you can see it is a today's data of the infected cases whole worldwide, and the total global death is around 5,00882. And in Indonesia, today's data is infected cases is 54,000, 500,400, 54010, and total death in Indonesia is, as reported, is 2754. So if we calculate this in percentage, how we can see the global infection and the percentage of death is 4.96 all over the world. And in Indonesia, the rate of percentage of death is 5.09. USA 4.94, Malaysia 1.4. So all this data give an aspect that how COVID is affecting our daily day-to-day life in different countries. It is not only Indonesia, not only one country, all countries affected same way. Now, for this, we are the workers, health workers is working continuously 24 hours in different aspect. The police also working. This also called as a part of the health worker. The drive-through testing. In different countries. It is not only Indonesia, not only. Hello? Can you hear me?
Yeah,
Hello, can you hear me?
Yeah, we can.
Okay, okay. So these are the health workers, and we are facing two types of condition we have to maintain. There is one is physical and one is mental. Two types of health we have to concern. As we know, the total global expansion all over the economic output was to be increased and 3.5% to 3.60 in 2020. But what happened? Total lockdown in all the countries, in different countries like Indonesia, it is more than I think 60 days is lockdown condition. So there is a contraction in the GDP and global economy is going down. So around 3% of total global economy has been contracted already. And there is projection growth also decreased. All these economic condition is giving a what we call impact on our job sector. Like Indonesia, there is 2.2 million people have been laid off in different sectors. That is not means it is May data. Maybe June it is more than this. And also in Malaysia also in May it is around 600,000 people jobless. So more than 17% or means around 20% people is jobless. Now this thing is going to be increased as long as the MCO or the lockdown is increasing. So now the Indonesian government and Malaysian government, all country government is thinking how to means release the lockdown, and we are moving towards this what you call the normal life, new normal life, as we can tell. So as you see, there is a Malaysian airport, all of you know that previously like this condition, now this is empty. So all persons has become jobless. This is a economic crisis. And for this, I can see there is also the lack of access of contraceptives in COVID during COVID time, and the total centers, all the centers have been closed down in Indonesia and all over country, not only Indonesia, it is all country situation, that all the other healthcare facility has been closed down. So the people cannot go for contraception and other things. So this is affecting the reproductive health. I'm just giving a relation, not my area of topic of reproductive health, but I'm just giving a relation how the reproductive health also affected by this COVID. And now see the newborn babies have to be given face shield, etc., and kept in different means have to give proper care. Now you can see other countries, many other countries have defined news also that 8 months after pregnancy, she go to the hospital refused to admission because there is a case of COVID in the hospital, so they don't want to take admission of the pregnant woman. So the pregnant woman, what we call, go to other hospitals, and other cases, in different cases, they go to other 8 hospitals after refusal. She died in the ambulance itself. Another case we have seen, many cases are there like that, that pregnant women go to hospital and the the assistant, means the doctors and everything, they thought that she has a COVID infection, she may have. So they told, you clean your, what do you call, the baby after delivery, the blood, etc. You clean yourself. So the mother, after delivery, she going to clean the bloods, everything. And in that time, her baby died. So these things happens during this COVID-19 situation, during the reproductive health. Now, there is a urge for the ministers that don't go for more pregnancy, etc. Baby born to be how to call postponed, like that type of announcements are there. But major thing is, in reality, it is different, and they cannot get the facilities properly. On we cannot get, so that is a different issue. That hospitals and health workers are working day and night. You can see in Indonesia, many doctors, nurses have been affected, and they not that after affected or being daring of affection, they are stopped work. In every countries, they are working hard day and night. So there, as I told you, that there is a depression in the economic sector, and this economic recession is never happened before within 20 years of our what do you call, in this situation. Never get in this type of 20 means within before 20 year or maybe 50 year, you can tell it never decreased like the recession like this. So in this recession, many persons get jobless, so they are getting depressed. This is the impact of recession, and this economic recession, COVID, going into economic recession, and then depression comes. What is depression? As per WHO, it is a black dog syndrome. And this black dog is always with us every day, everyone's life. It is not that COVID come and the black dog come. The black dog was there, but the condition when the depression is more, then black dogs become bigger. And we are going under the black dog. Not that black dog is under us, we controlling the dog. Dog is under, we are under the shade of the black dog. So what is going on? We cannot come out from the shade until and unless we try and make up our mind. So what is depression? Depression is a mood of disorder. As all of you know, that it is sometimes depression. There are many symptoms like feeling of sadness. We feel sadness, emptiness, angry outrage. We are becoming angry suddenly. We beat people, we beat our children, like that. Then sleep disturbance, we cannot sleep at night, maybe somebody, and maybe somebody have loss of appetite. Then they have anxiety, they develop diabetes also. And so these things are badly affected our pregnancy life also in reproductive health. So there is a, this is the pathophysiology of depression. So now, what is, so according to American College of Obstetrics and Gynecologists, they told previously, not now, they told around 14 to 23% of women will experience some symptoms of depression during pregnancy. Because they are working at home, they may work at office, and also they have to take care of their own health, personal health. So that is, if they are pregnant, so the depression attacks more on that type of condition. So there is a misconceptions about the prenatal depression is there, and that depression during pregnancy and after the childbirth. Two types of depression we can observe. So these are the most important thing when we have to take care, we have to think about the depression during the reproductive health. So it is like when a person works day and night and come to home, that workplace, they get more weakness and they feel sad. This is a anxiety during the overworking, overwork burden. These are the what you call situations of depression. So now no doctor can provide bread at our home. So when our hunger is not ended, then only our mind become cool and we can think. Like I am giving lecture, if you are hungry, that anybody can, what you call, cannot listen at what I am talking about. They will think, oh, I have not taken my lunch, I have not taken my breakfast, like that. So they cannot concentrate, we cannot concentrate until and unless we feed ourselves. But as we are jobless, we cannot feed ourselves. So what to do? We cannot give our food, means food to the children, food to my household persons, my relatives dying in front of me. So all a depression coming or these type of situations. So now how to overcome? We have to set goal that yes, for this we are living, and there is a we have to learn that yes, not this COVID situation, for this I am living, not for this money. I have to set a goal that yes, this is my goal of living. Then keep active. We have to read and write. I will tell about these things again. Then we have to be lighter mood, that if we talk like this type of things, that everybody will be more depressed, of course. Like, oh, this is the death in Indonesia, this is the death in from morning I am giving lecture of these things, so everybody will be depressed, of course. So now then we have to eat sufficiently and exercise, maintain hope that yes, the COVID we can tackle. Then actively use stress management technique, accept feelings, that angers whoever is angry. Is suppose my husband or my wife is become angry, then I have to think why and how she is angry, because there she is also feeling some depression. On that depression outbreak is this anger. So we have to accept the feeling of others, means fellow. So there is a nice book, Man's Search for Meaning, by Dr. Viktor Frankl. So he told logotherapy. Who is Dr. Viktor? Dr. Viktor is a prisoner during the World War II, and he was present with the other prisoners, all the family members, everybody is dying during that time. Nobody has to take the body out from that prison. After 2-3 days, the person dragged the body out. That time the leg come out, hand come out. That relatives, not that my own wife, my own daughter, my own son, that his condition is dying like that in front of them. And the food is giving only 1 cup of soup every day. So after 2 months or 3 months, when they're going to release, that when they're coming out, they cannot walk 5-inch or 6-inch stair, go up. But Dr. Victor is living. 1% of the fellow of his Dr. Victor was in the same, in the same prison. He thought that yes, on 31st March, he come to Victor and tell, yes, 31st March, I have given a dream that 31st March I'll be released. So he is very happy. But after 20th March, when he seems that he cannot go out, so he become depressed. On 23rd March, he become more depressed. 25th, he stop eating and he become to lie down on the bed, and 31st, he expired. Because he has a hope. The said goal was 31st March, I will go out, but cannot go out. So 31st March come, he died. But Dr. Victor not died because he has some dream and he has some set goal that I have to write this book, this diary on man's search for life. So he created this logo therapy. The logo means reason, the reason for living. So only motivation in our life can lead for living. So now, as we know that this mental health condition, as I told you, that World Health Organization has been given some points which we can follow in our daily life to get rid out of this good mental health and getting out from this depression. So we have to keep informed that what is going on all over the world. This news I give you, that does not mean we have to think that yes, oh, this so much died. No, it is the information. Yes, Malaysia is 1.5, Indonesia 5.4. So what action Malaysia is taking, what action Indonesia can take, what is the difference? This thing we have to inform. We have to take that. We don't know that what is going on in China and we don't know what is going on in Malaysia, then we cannot control this situation. We cannot overcome this outbreak. So we have to keep informed, have a routine, give a daily routine, eat a healthy diet, personal hygiene, clean hand, etc. As long as we can afford. That you cannot think that okay, one slum living dweller can clean hand with sanitizer. They don't have even water also. In some countries like South African speaker also there, we know water scarcity is there, everything is there. So they cannot have the clean water also for drink. How they will wash? So these things we have to maintain. But how long? As long as we can do, we have to do. So then we have to minimize news feed. Then social contact we have to increase. We have to talk much by phone, by other things, by chatting. Then we don't have to take alcohol, and we have to get out from the screening time because we are locked down. So we are watching this computer all the time, gadgets, electronic gadgets. We have to break this gadget timing. Then we don't have to be involved in the video game long time. We have to be social media. We have to correct that. Yes, some misleading information is there. We have to correct that information. Yes, it is wrong. We should not spread what you call it, bad news in the social media. Then help others. We must help others. When suppose I am in lockdown condition, my neighbor also in lockdown condition. Neighbor is aged person. He cannot go to shop, or he is sick. I have to give medicine. I can go out, so I can bring medicine and I can bring food. I can support him. Like that, we can support other health workers also. Not that health workers cannot be supported. So all this information you can find in the WHO website. So how we can support? You can see the here is in Malaysia. It is there. They have given influenza vaccines, etc., to the Grab drivers. Grab means food panda drivers, Grab drivers, etc. So they are also here means workers who are working for 24 hours. These Grab drivers, food panda drivers, means distributor, postman. They are working 24 hours for the cleaners, but we have to support them. So we are giving, we are trying to keep, we can try to give the vaccines, etc., to them. So now we have to think, what is this COVID? Before COVID, we all of us in comfort zone, this red zone. We all feel safe. We are at home. We are doing normal life. Then when COVID come, then we are in fear zone. So COVID is there. So I am very much fearful that everybody can be infected like that. Now, after that, lockdown is for what? Lockdown is the learning zone. We are learning how we can cope up with this COVID situation, how we can go out, we can tackle with the COVID. It is not that lockdown will tell, yes, COVID is dying by this lockdown. No, COVID will stay, and we are also staying. So we have to think and we have to manage our power, how we can tackle this situation of this is the learning zone, how we can handle this situation. So after this, we are in growth zone. When lockdown is moving out, we are in growth zone. So we will again move out and we will again go for the business, etc. We are again meeting, but in a new style. So in this, we can tell this is a grief model. All of you know, maybe many of you, as all of you, many of you is like nursing students and psychological nursing students. So they know this Kubler-Ross model. What is there? In this Kubler-Ross model, there when there is a person infection was corona count is 100, then everybody is fearful. Now it is more than what you call million. Now I just give a data, not that it is actual, but now it is the, you can see that data is more, infection is more, dying is more, but we are not afraid. We going out for work and we are why? Because this model, denial, anger, depression, bargaining, and acceptance. What is this? Denial is refusal, that I don't want to believe that yes, China is affected. China is cold country. So Indonesia, Malaysia, these countries are in Asian zone is hot. So we will not get affected. So after that, we got affected. Then we are angry because we are losing job. And this China give this virus. It is not that China give the virus. Virus is there. Maybe China from it is distributed from originated from China. We don't know. So, but the thing is that the virus is here, and we are getting jobless because we cannot do business. So we become jobless. So we become angry. Then we are bargaining that how we can tackle this corona, that we can take these or not, or these things, etc. So we are getting depressed that we cannot handle. We know already that medicine cannot discover within 15 to 20 years easily. One medicine actual laboratory time is 15 to 20 years. And vaccine also is not easy to get. Like dengue, we cannot get vaccine. Corona also having more than 20 variety already, 20 strain. Hey, sorry, 10 strain. So there is a less chance of developing vaccine immediately. So we are giving some trial drug already there in the market, like hydroxychloroquine. We have WHO giving trial. After that, they told cannot because this is a side effect. Like that, many things we are trying and trying to get the infection means the control of the infection. Now, after this, we are accepting that yes, corona will not go away. we have to stay with this corona, and we have to how we can manage our life. So this is the Kubler-Ross grip model is implicated in this situation. So when there again, I am telling Dr. Victor's word, when we are no longer able to change the situation, we are challenged to change ourselves. So we have to modify our living style in the new world. We have to maintain safe distance. We have to wear mask. We have to check temperature. Wherever we can take the measures, we have to take. Now we have to think that life is a game, and all the balls have different opportunity to hit sixer. So one ball miss, another ball is coming, we have to play. We don't think, oh, this ball come and I cannot play, I have jobless, so cannot feed in the whole life. No, you are jobless now. So there may be another job coming. We don't know. So we have to wait until and I've searched the clue that how we can get the opportunity to survive again. Like that, when we are thinking that we cannot conduct any conference, we think, oh, we cannot meet with each other, we cannot do any scientific progress. Now we have on this Zoom, we are using Google Meet, we are doing online conference, online education. We have started, like in our university also, we have started all online education, all classes going on online. So these things are new, and we are taking the opportunity. If we don't take this opportunity, we still in this, what you call, in this comfort zone. We think, oh, nothing will happen. We are in safe zone. We are staying at home. Then we die. We have to come out from this comfort zone. We have to learn, and then we are going to the growth zone. So we must tell the struggle for existence and survival of the fittest. So we are struggling every time. We have to struggle. We don't lose ourselves before we die. And even as we soldiers, we can know that when they cut hand also they can fight because they have the mental strength. So if the struggle, we are struggle, then survival of the fittest, as Charles Darwin told, and who will be survived? It will be decided by the nature. Nature will decide who will stay. The virus will stay or human will stay. A dinosaur will stay, a cockroach will stay. So that we don't have to think. We have to focus how we can maintain our life and how we can go out of this depressed world, and we can cope out in the new normal life. And in these things will continue in our reproductive health, in the child health, and also mothers and all the community, not only the reproductive health, whole world, whole persons, everybody's mental condition, depression, we have to go out. We have to think how we can tackle. In this aspect, I would like to thank Sykes Mitra Husada, Medan, to organize this seminar with all the organizers. Thank you. Thank you very much. Any questions is welcome. Thank you.
Okay, thank you for Mr. Sandeep Poddar to share your knowledge and experience about the COVID-19 depression and its effect. So this conclude about the COVID-19. The best way to fight COVID-19, such as routine task activity and play game and etc. And the next we will the section about the question and answer. And the question from okay, wait, we will collect the question from participant.
I see one question in chat box from Pakistan.
Yes, please.
PhD scholar Umar Jamil.
Yeah, yes, please, sir.
Asking that according to the WHO, it is not spread by touching each other. Is that true, or just the give statement for increasing the COVID cases? No. It is not that spread by touching. We have to think how we are touching. This COVID is not spreading by the touch, by body touch. COVID is touching by, spreading by the droplets. The virus is in the, it is a, it means respiratory virus. So when the respiratory droplets like the sputum, etc. is there, and that droplet is infecting us. So we wear mask. We washing hand, why? Because this hand we are touching every time in our face, eye, we are touching unknowingly and knowingly. So how many times you don't know, you just be careful, then you understand that when I am touching my hand, I am just doing like this, etc. So when I am touching these surfaces with infected droplet, that will come to our contact, near contact about our respiratory systems, then I can get affected. It is not that I just touch one patient without that infect, means touching the droplet, it is infected like that. And it is not that WHO told you go and hug everybody. They already told maintain social distance. So we don't be confused. We should not be confused that yes, WHO told I cannot be contacted, so I go and hug everybody, the patient of COVID. No, WHO not told that. WHO told keep safe distance, keep social distancing, wash your hand. This thing you have to keep mind. Not that WHO told that you have to means it cannot be spread like that. Yes, it is not like that. Like HIV, if you don't do body fluid connection, it will not spread. Hepatitis B, if the HCV, not bloody fluid not go, it is not be transmitted. Like that same, if the droplet if not spread from one person to another, it cannot be spread. It does not mean that you go and touch, it will be infected immediately. So the patients, everybody, the doctors going and taking care with proper precautions. So that we have to think. Okay. Any more question from your side?
Oh yeah.
Another is there, I think. What do you think if woman pregnant, reproductive mother exposed to COVID-19 in trimester 1, 2, 3, should we maintain or we should take high risk in baby or save the mother? That have to depend upon the mothers, and if it is, she is affected with the COVID, it depends upon the treatment, if how a condition is that. COVID is not that you can see the data, only 5% of the total infected cases have been death. So it is not that everybody will die. So we cannot think that there is survival rate is more. 95% cases survive. It is not that like type dangerous like HIV, etc. That I am infected, I will die. It is like same. There is a 95% chance of survival. So we have to focus on that. If how we can tackle that is on the patient's condition. Okay. And we can grow our immunity. As I told, the depression will lead to anxiety, and our anxiety will give our means what we call the lower level of immunity. So we have to strong boost up our immunity all over, and we can tackle the situation in our health. So body mind will control the body immunity, and body immunity will control the COVID infection. Okay.
Okay, thank you for your answer, Professor Sandeep Poddar. And the next question from Rapi Kumar. Desi Silaban, sir.
They say, okay, here, student of Dr. question is from result of depression in the world, especially in Indonesia. How does your response about COVID-19 greatly affect depression in pregnant women? Which is COVID-19 also attack many pregnant women and babies. As I told that if everybody is getting affected, not that only they are selecting the pregnant woman, they are selecting the baby, or they are selecting the old age person. Everybody is same chance of getting infected. So now when we are mentally strong, then as I told, as just now, that immunity power should grow up. And that immunity power, if grow up, then only we can tackle. Somebody telling that yes, when you are COVID infected, you stay at home, isolate yourself, you lie down on bed, become your body what you call energy less expense, and then you take some more vitamin C and protections, and then you can survive, because your respiratory rate is low, then this respiratory distress will be low. But I don't know the situation. Medical doctor can explain how it is infecting, how it block the lung. It is very bad condition when it is infected badly. So before this heat so strong, we have to tackle. So before we infect, we take precaution. We get our immunity booster. So then only we can prevent. Okay. Any other?
For the last question from Sari Duma, Tikes Mitra Husada Medan, sir.
Okay, so Duma, how is the handling of newborn in COVID-19 in your country? Yes, there is they have separation in ward, etc. So they are taking proper care. Like I know that wound care management center, the doctors have been shifted to COVID center like that. So they have isolated centers for COVID infection. Not only in our Malaysia, also in all countries they have the isolation centers. As per WHO protocol, WHO give the idea how we can tackle. You can see in the WHO website. I'll share a little bit later in the chat group that there is a guideline. Every hospital should have a separate COVID center, and suppose this type of percentage of what we call patient will be shifted there. So if any children or anybody is affected, they will be shifted that side, and they will be taken special care for the COVID. And many persons is surviving, not that everybody is dying for this, but also many persons is dying without reaching to hospital. That is also true. So there is two types of thing. One is in the hospital they are getting treatment and not getting cured, and in the hospital they're dying, and also before reaching to hospital they are dying, and somebody before reaching to hospital getting cured. They think only cough and cold, because my body power is immunity is more, I getting cured at home. Same like other diseases like dengue. One person get infected, can be cured at home. If it is hemorrhagic dengue, he go to hospital, take blood transfusion, can be cured. If hemorrhagic dengue is more, the hospital give blood transfusion, platelet transfusion, nothing, he will die. Dengue also, patients dying. It is not that everybody is dying for dengue. Same thing, we have to think about this COVID-19 also, that it is not everybody dying and everybody reaching hospital. Many persons without reaching hospital, 80% patient cured outside. And before reaching hospital, many patients dying in the road also. Okay. So I think I'm clear my presentation. Any more?
Bisa satu lagi pertanyaan gitu.
Sir,
Yes.
we have one more again for question for you.
The last maybe.
The last question maybe, sir.
Okay.
From
Rina.
Rina.
Okay, Dr. Rina Puspita. What do you think about new normal? Is that going up? Really normal? Because people act like everything normal, but as we know, the vaccination not found yet, how we can lecture start education again, or we will still online teaching before? Yes, vaccine, I told you that vaccine is not cannot develop within 15 to 20 years. If develop, it is a bonus. It is a gift from the scientific world. Dengue, we cannot develop vaccine. HIV, we cannot develop vaccine. Cancer is cannot curable. So we cannot think that COVID-19 within 1 day or 1 month will get a vaccine. So we have new normal life. We are leading to normal life, but it is a new normal life. What is new normal life? As I showed in my slide, we have to maintain, keep safe distancing, wear mask. We have to keep social distancing. Like in Malaysia, during Eid also, they don't open the mosque. Even now also they don't open mosque, temple, churches, etc. So social gathering is closed. So we have to think that we cannot think that, oh, okay, go during Eid or something, we are going and hug everybody, going to celebrate Hari Raya like that way. No, it is a new normal. We are going back to normal, but new way. The seats in the classroom is separated, and we are going more online mode of teaching and less practical, means what you call physical teaching. But practical, as we know, nursing, health science, they need practical. So government is thinking how we can implement practical also. Okay. So there is a
Okay.
change in the new normal area.
Okay, thank you, sir, for your explanation. I think that's enough for answer and question.
Any question later on, you can ask me, you can email me, you can call me, anybody. You can distribute my phone number and email. So I will be happy to answer, no problem.
Yeah, for all participants,
Yes.
I will share your number and email or if they have a question. Okay, the last I said, thank you very much for your share knowledge, and I say, and see you again, sir.
Thank you.
Thank you.
Thank you.
And the next, we will continue in the next keynote speaker and will be moderated by Mr. Edi Marjuang Purba.
Thank you, Mr. Julkarnain Batubara. Ladies and gentlemen, we will continue for the next keynote speaker, Dr. Sounthone Phothisane from College of Health Science, Savannakhet, Laos, with the title COVID in Laos. Before we start our presentation, I'd like to read curriculum vitae of Dr. Sounthone Phothisane. Dr. Sounthone Phothisane was born on June 4, 1958. She has obtained Bachelor of Medicine at Sounthone University of Medicine in 1984. Master Public Health Institute of Sounthone, Laos PDR in 2000. Master of Education Management, Sakonnak Rajabat University, Thailand. PH of Educational Administration and Leadership Sakon, Nakhon Rajabat University, Thailand. Some of work experience are Vice Director of Savannakhet School of Medicine, then Director of Savannakhet School of Public Health, and 2011 until now as Director of College Health Science Savannakhet. But today, Dr. Sounthone Phothisane will represent Mr. Vinay. So, Mr. Vinay, now time is yours.
Okay, hello, my name is Vinay Chansampu. Can everybody hear me? Hello? Hello, can you hear me, please?
Yes.
Okay, hello, everybody.
Hello.
My name is Vinay Chansampu. I am on behalf of our Dr. Sounthone Phothisane and the director of Savannakhet College of Health Sciences. And today, I am very grateful to be here to present about our COVID-19 situations on Laos. Firstly, I will, sorry. Okay, today I would like to present about COVID-19 pandemic in Laos PDR. And firstly, will go through 4 important parts, including pandemic situation, socio-economic impact, government support, and future plans. Firstly, I would like to introduce about Laos PDR. Laos PDR has totally 18 provinces. Area is 237,955 kilometers, and population is 7 million people. And capital of Laos is Vientiane. Okay, and this is an overview about Laos Democratic Republic. Laos PDR has made good development progress over past 20 years by halving poverty, reducing malnutrition, and improving education and health outcomes. Economic growth in Laos PDR has slowed over the past 5 years. Growth fell from 6.3% in 2018 to 4.8% in 2019, due primarily to natural disasters that affected the agriculture sectors. Moreover, COVID-19 outbreak is expected to further intensify the country's macroeconomic vulnerabilities, with limited and foreign currency constraining ability of the government of Laos PDR to mitigate the economic impacts of the pandemic. Okay, and the next is I would like to tell about the pandemic. Firstly, this is the timeline of infected patients. Okay, as you can see, the number 1 male is 28-year-old. He is a hotel employee, live in Vientiane. Number 2 is female, 36, and the number 3 is male, 26. And in 25 March, we have another case. Is the number 4, male, 42 years old. He is a close contact with number 1, and the two other is male. And on 28 March, we have other 2, female and male. Okay, and the number 8 is female, 22. She is a student who came from Thailand. And the number 10, and especially number 11, who is a foreigner. He is a Papua New Guinea. He is a businessman, works in Phobia. Yes. And 12 is female, 20 years old. This case is English student. Last student who study in England, sorry. And the next is the number 13 is male, 40, a close contact with number 11. And the 14 female is last student arrived from England. The 15 and 16 is female, yes. And totally in Laos there are 19 cases, and until now we don't have other infected. Okay, and this is a map. As you can see, most of patients have been infected from other countries before arriving to Laos. For instance, number 2, which is sorry. Okay. For instance, number 2, which is a guy leading the foreigner tour, or number 1, who communicated with foreigner. And those students which were arriving from England, which has serious situations at that time, but luckily, our government figured out and treated them in time. As you can see in the map, in consequence, we have 15 cases in Vientiane and 3 cases in Luang Prabang, and there is a Papua New Guinea, which is a businessman, works at Pubier mining. Before this, he had arrived from Singapore before came to Laos. And this is the total infected case in Laos. And the pandemic situation. Laos announced to close national, international, and local borders checkpoints on 30 March before the first infected case had been confirmed on 24 March. And after a week, Laos going to lockdown and exhibit curfew policy between March 30 and 19 April. According to the increasing of cases, Laos government had expanded the lockdown period for other 14 days. Therefore, the traditional Lao New Year must be cancelled. This was the first year that we can celebrate our traditional New Year, which is the most important event in Laos. However, 2 days later, we had a good news. That was the first treated case left hospital. And until 6 May, the government has reduced the intentions of lockdown, but still keep social distancing. Many people have been working normally, except entertainment venues, international border, and on 7 May to present school reopen normally and allow traveling on after 7th May. And in the result, we have totally infected case is 19 cases. About the treated case is 19 cases. Also, the shortest treated period was 10 days, and the longest took 75 days. Tested case, we have totally 14,000 case of overall suspected cases, and there are 19 infected cases of them. And specific in Savannah-Khett, we have over 2,000 test cases because Savannah-Khett has a very large province, so we have a huge number of test cases. And this is the Savannah-Khett province. Savannah-Khett province has many districts, and it is the number of migrant laborers quarantined from each district. As you can see, Sounthone Phothisane, which is the capital of Savannah-Khett, we have totally 4,000 quarantine cases, and 2,000 of them have left. Utumpon is another district in Savannah-Khett, and we have over 3,000 quarantine cases, and as for Sounthone is 1,000 cases, and Pin, as you can see in the table. Okay. And after it, I will talk about a socio-economic impact. Firstly, I would like to tell about social impact. Sorry. Okay, since Savannah-Khett has received a huge number of migrant laborers from Thailand came into Laos. After migrants arrived to Savannah-Khett, there are particular vehicles to transfer migrants to their districts and keep isolated at district quarantine. They use school as a state quarantine. It has the authorities to restrict and follow them. After due 14 days of quarantine, they will allow to back home. And this is the number of each district in Savannah Cape. Yes. And the next one is about economic impact. Firstly, I would like to tell about a social impact. The social impact is firstly educational institutions. School, colleges, and universities had been closed. Many institutions would be switched to online platforms. National curfew, government announced curfew after 8 p.m. So nobody can go out after 8 p.m. and every shop or restaurant have to close before 4 p.m. Cancel many events, many important events and ceremony had to be canceled, including last New Year, which I have said it is a important.
Mr. Vinay, there is something troubles? For our participant, we are sorry. Mr. Vinay, there is something troubles.
Okay, sorry about the connections.
Yes.
Okay, sorry.
Welcome
so
back, sir.
Okay. Okay, I will continue about the topic. So sorry again. The next one is about economic impact. Okay. Economic on business and operation. This is the survey of the risk of ceasing business operations. As you can see, the diagram is the survey about risk of ceasing business operation in Laos, by Laos National Chamber of Commerce and Industry of May 2020. As you can see, there are 8 parts of diagram. The first one is 10% risk of going out. It takes 37 of all operations that have a risk of going out. The next
Ini
one
gimana sih cara matiin ininya?
The next one is 80 risk of going out. It takes 14% of all, and 50% of going out is take 10%. And the next one is 30% going out is just take only 5%. And the final one is 0 risk of going out. It only take 2% of them all. Is as you can see, it's very tiny number. And the suspend 3 months is take 14%, and suspend 2 months is take 7%, and suspend 1 month is take 11%. And in conclusion, based on the risk, and the next one is workforces. Percentage of business and operation expected to lay off staff. 90% of business suspect of and lay off staff, it takes 30% of them. 71 to 90% to lay off staff, it takes 14%. 51 to 70% to lay off staff, it takes 12%. And the next one is 31 to 50, it takes 12% also. And the lay off 1% to 30% of staff, it takes 80%. And no lay off staff, it takes 31%. Okay. And okay. And it is the estimated impact on business revenue on Q1 2020. The education industry is the small one, and the most impacted is agricultural, forestry, and fishery. The following is wholesale retail and motor repair, manufacturing, contractor, tourist, and this is the impacted industry in Laos. In conclusion, based on the result of COVID-19 impact on business survey conducted by Lao National Chamber of Commerce and Industry, we can estimate the impact on business revenue on Q1 has been agricultural, forestry, and fishery, with loss of approximately $292 million compared to 2019. Therefore, this offers an overview of prices to be used as a basic developed solution to relieve those impacts. And so that I would like to say about the government support, how they relieve the policies. On the economic relief policies, we have 4 important policies, including tax reduce, deferment of payment, duty relief, and lower electricity costs. One, tax reduces. We exempted from paying income tax for 3 months from April to May, June, and deferment of payment. Government has postponed payments for affected business in effective 4 months of April to June. About duty relief, government has exemptions from customs duties, tax, and related official fees. And the final one, government has help support about electricity and water expenses, which is reduce the cost of electricity and water of low-income earners. And the next one is prevention measures. Education, kindergarten, primary school, grade 1 to 4, secondary school, grade 1 to 5 and 6. Preschool as a kindergarten as well as primary school levels 1 to 4, and secondary school level 1, 2, 3, and 5 and 6 may resume classes. Final year classes at vocational school, teacher training colleges and universities may resume classes, as well as training session or short course. And the next one is workplace condition. We should have a spacious enough food hygiene, hand washing station, and temperature checks. The working environment must spacious enough to guarantee social distancing, clean water, hand washing stations, alcohol due and must be available for all employees. And the next one is international condition. Some border checkpoints remain closed. There are no reopened yet. And the entertainment event, entertained venue reopened but have to keep social distancing and have to follow the prevention measures. Establish meeting ceremony event with limited participants. Okay, and in the future plan, development we the government have to carry on relief policies, including lower expenditures, exemption tax and duties for lower incomes, such as workers unemployed and risk operators, provide career recruitment for unemployed regarding to promoting agricultural industry, providing agriculture and domestic knowledge to unemployed that they can apply for their living, support the safe and inclusive return to school education in institutions for learners, such as provide free masks, alcohol, gel, lower fee for some targets. And the final is support national factories and industry to supply consumer goods in country, lower import goods from other countries. And in conclusion, despite despite limited, despite the still limited number of COVID-19 cases, the region has impacted trade, construction, and tourism, and has therefore a significant effect on the economy. La PDR needs to act immediately to prepare, respond, and recover. The government will support country through each province and district with a focus on the most vulnerable. Lao government has been identified for support citizens and business operator response include regarding to socio-economic impact and needs assessments, inclusive and integrated crisis management and response, health system and communications support. And this is all about the presentations, and the reference I have followed is the latest COVID-19 situation report by Savannaket Department of Public Health, COVID-19 pandemic and socio-economic impact on by Ministry of Public Health, survey report on impact and another references. And this is all about the presentations of Savannaket College of Health Sciences, and behalf of the director and Savannaket College, I would like to say thank you, and it is a honorable event for me to be here. Thank you so much.
Thank you, Mr. Finney, for your sharing experience and many things. I think you have explained very clearly how about COVID-19 in Laos, and then many impacts, almost same with the other countries, many impacts of COVID-19 for the business, economic, and also for the health, of course, and for education. Now we are open the question section.
Yes, okay.
I will read the first question from Destin Murnianti, Bachelor of Midwifery, Stikes Mitra Husada Medan. How was the strategy on the Lao government so that health service remain stable and service to patient remain good?
Okay, as I said that government has support a lot of about tax and duties, so they are quite open about import goods from especially Thailand and Vietnam, which is the main resource of import goods in Laos. So they have reduced the tax and duties to support the operations or the logistic companies to import the good from other countries. So that Laos has remained the import good to supply for Laos citizens. That is how government have support and to for importing supplement in Laos. Yes. So how about the other questions? Do you have another question? Hello.
The next question from Donna Basaria Tampuolon, the Bachelor of Midwifery, Stikes Mitra Husada Medan, is can you explain how system education from Laos while quarantine? Thank you.
Sorry, and again, please, I couldn't hear it clearly.
Yeah, the question is can you explain how education system in Laos while the quarantine?
Okay, because the educations in Laos should have to switch to online platform because of despite there are no infected case in Laos, but we have to assure about not to have a risk about the infect. So we have to quarantine for be assured to zero infected case. So have the government have to switch and have to suggest to switch to online platform. Many preschool and kindergarten have to close, but currently we have to reopen and we have to study normally, but only primary school have to still keep social distancing. We separate the class. We separate to the class. One class just only 10 pupils, 10 and kids in one class. So and we have to keep social distancing. Yes.
Okay, thank you, sir. There is a question from Sriulina Kaloko. We know that in the pandemic area, the pregnant woman should visit health facilities like the health center. So how the government program of support to prevent pregnant women from the COVID-19?
Okay, and to lower the risk of infected, and government has followed and restrict of the prevention measures such as every medical staff have to wear a mask and wash hand clearly and frequently, and about the pregnant women, we have to test about the infected COVID, especially with unsuspected case. But luckily, we have no infected in pregnant women. But despite of that, we have to follow in intentions of prevention measures. Yes, about the pregnant woman, we have to focus and put important on them. Yes. Okay.
The last question maybe, sir, yeah. What are the main policies of the Lao government towards preventing COVID-19 so that is declared independent, free from the pandemic COVID-19, and how the Lao community responds to the Lao government policy on the case?
Okay. So as you can see about the timeline, Lao government has early respond to the pandemic before the first infected case have been confirmed. That means Lao government has closed every national and international border, and they prohibit foreigner to come to Laos, and even Lao people can go into Laos at that time. So they have to decrease the risk of COVID. After that, they have a infected case, but Lao government have to support by free treatment for infected case, and they have widely test about the suspected cases in Laos, and we have 19 of them. After we have infected cases, we focus on them and we treat them a lot. And there are three stages of test. And one is test in the province. After that, we have sent to the capital, which is Vientiane. And if there are emergency case, we send the test to other countries to help testing, which for example, Vietnam or Thailand, to help to test about it. But so that Lao have to decrease about the infected cases, and they have a particle quarantine state and treat in the sorry, they have to be treated in separate quarantine state, so they have to lower the risk of infected to other cases, and that's how government respond to the infected cases and lower to 0 case in Laos. Yes. Okay.
Thank you, sir. But because the participant very enthusiastic, so
yes, right.
How about one question? Because so many questions here, but we have one more.
Yes. Okay. Thank you.
From Dr. Rina Puspita from Jawa Timur, is Java of Indonesia. Do you have any advice to us? Because is Java or Jawa Timur the big province in Java Islands, and now called is black zone due to the high of COVID-19 infected people. Do you have any advice to government? Is it that lockdown is must to this the province? Thank you.
Oh, okay. As a citizen of Laos, and as a citizen of Laos, I just have advice about that. As a citizen, we have to follow restrict. We have to follow intensively with prevention measures that government has provided. Just as if government has have to tell us to quarantine in the house. So we have to do so. We have to strictly carefully with the prevention measure, and furthermore, we have to follow the World Health Organizations about the prevention, such as wearing masks or clean hands by the alcohol, or stay and social distancing. As you can see, I stay in the room alone because we have to social distancing, and if I go out, I have to wear mask. That is, I have to follow the prevention measure carefully. That means that's why we have to decrease the risk of the infected. And I'm not sure about Java, Timor, how it's been there, but the thing that you have to do is just following the governments or following the prevention measure that World Health Organization has established, and that's how we do and it allows. Yes. Okay.
Okay, thank you, Mr. Vinay. So
Yes.
many experience that you have sharing for us. We
Yes,
hopefully we will take the lesson about it, and we can prevent the COVID-19 pandemic in Indonesia, of course. So
Okay.
now we are going to the next speaker, and the next session will moderate by Mr. Zulkarnain Batubara.
Okay, ladies and gentlemen, the next keynote speaker Professor ZAHRAH SAAD from M.S.c University. Before we start our presentation, I would like to read curriculum vitae of Professor ZAHRAH SAAD. The name of Professor ZAHRAH SAAD, nationality Malaysian, and position former Dean Faculty of Nursing and Midwifery at Malaysia Applied Health Science Academy of M.S.c University, member of Malaysian Nursing Board for 3 terms, failed from Malaysia Quality Assurance, and trained the trainer. And next, chairman for the Special Interest Group in Education under umbrella of Malaysian Nurse Association 2013 until 2016. Chairman of Nursing Professional Group Malaysia 2018. And the first Malaysian senior nurse to receive the following to attend the Nursing Global Leadership Institute. In September 2010, member of Global Nursing Leadership Institute and member of Global Allied Nursing and Midwifery, and founder of Al-Falah Zcare, and in 2010, an elderly care certificate UK, University of Singapore, University of Thailand, life member Jim. Excellent service awarded by State Director of Health and Director of Health Malacca and Queensland. And the last speaker national and international ECN Barcelona, May 2017. Publication 5 books and 10 of plus report. And she has motto lifelong learning. Ladies and gentlemen, I would like to welcome Professor ZAHRAH SAAD. For Professor, time is yours.
Okay. Thank you. And Bismillahirrahmanirrahim. And good morning to all, especially the panel, the participants. First and foremost, I would like to take this opportunity to congratulate the scientific committee for organizing this webinar, and congratulations to the principals, Ibu Siti, and I also would like to and congrat and well done, Ibu Siti Nur Mawan Sinaga, and let me start this by addressing that since I am from MASA, just introduce MASA with short briefing. We are here at MASA just half an hour from International Airport, the new building. We were at the Jalan Ilmu near the hospital, near the University Hospital 10 years ago. Now it's already 5 years we established at the Saujana Putra with almost 8,000 students and 2,000 international students. Yeah, this is the new norm. First webinar for international for Indonesia, and we used to have this webinar in the country few times during this MCO. Before I proceed with the topic, let me introduce about the situation in Malaysia. I hope the person in charge can share their screen before I proceed. Okay. Okay. Yes, next one. Yeah, this is MASA, and my topic is on the role of nurses in the protection of elderly care group. As I can see, there are few subject content given in line with the theme. And today, everybody talking about the COVID-19. And from my perspective today, I would like to share on the protection of the elderly care group with regard to this role. And my references based on the few reliable resource such as from WHO and from the Ministry of Health, and also from the nursing journal, the current one, and also the focus group. I did some short survey on the focus group. Let me share with you the Malaysian situation now. We are under the movement control order, and we already enter a recovery phase, Alhamdulillah, beginning this first week of June, yes, until August 31st. Our Prime Minister Tan Sri Muhyiddin Yassin said that we are now going to go to the next level is recovery phase. So again, the MCO as first imposed on March 18 to control the spread of the COVID-19 was previously extended 4 times until June 9. And we were here for the past 12 weeks, 3 months. We were with the students online, all e-based. So it's online teaching is not new anymore. It's a new norm. Our student also didn't go back to university. We are still with online teaching with the students. Yeah. So this is the presentation today I would like to share, especially on the protection of the elderly. Since my background is more on the gerontology, and how Malaysia has successfully contained this one, the spread of the pandemic, and will now enter the recovery phase. As you know, we almost can say in the recovery phase, And under the recovery phase, MCO, almost all like social, educational, religious and business activities as well as economic sectors will reopen in phases with standard operating procedure to be adhered. This is just sharing with you. And only last 2 weeks, we were allowed to cross the country. So before, we are not supposed to cross the state. We have to be at home, stay at home, and only the nurses and the frontliners go to work. They ask us to stay at home. And now, during the MCO, which I think they give the, let's say, for us to go out of the state, so we can go out of the state. So anyway, the interstate travel will be allowed except for area placed under enhanced MCO while the country's border will remain closed. So this is what I want to share with you, the Malaysian scenario, where I show you the statistic there. Almost daily COVID-19 will be reported by our Director General. And the one I show you is the 2 days ago, 3 days ago, 26 June, which the new cases come to the single digit. And for the past 13 days, no more death. We remain at 121 death. And altogether, the cases of this COVID, 8,606. And we can say the recovery phase, the percentage is almost 96%. And situation now, I can say Alhamdulillah. Okay, I can say that Alhamdulillah. So now, that is regarding the Malaysian scenario. So the impact of the COVID-19 pandemic on the older adults. So this is what you can see, the challenges of the COVID-19 pandemic are different for various social and demographic group. Yeah. And as you see the next slide, the World Health Organization state that for the elderly is those 60 and above. So in the statistic for the death, I can say that above 90% are the elderly. So the challenges of the COVID-19 pandemic, as what you said, is more on the demographic group, and older adults are more likely to already have underlying condition, and such as like cardiovascular disease, diabetes, or respiratory disease. Okay. So now you can see the older, the functional independence because of their physical disability, poor health, cognitive impairment, poor mental health, their low income and gender, age, financial dependence, and race and ethnicity. So apart from the Malaysian scenario, so my presentation is based on the elderly care, the impact of the COVID, and also I will share with you from my perspective the role of the nurses for the caregivers of the elderly. Yeah. Okay, so the roles of the nurses for caregivers of the elderly here, as you know, as the result, you see the result because of the elderly, the weaker immune system, so make it harder for older adult to fight of the infection. So how the role of the nurse for caregivers of this elderly? How you're doing the caregiver assessment? How you identify the key caregiver? How you going to assess caregivers' roles and relationship to patient? So identify need for caregivers, include the caregiver in planning discharge and providing care to person at home. Yeah. So according to according to WHO in April 2020, more than 95% of COVID-19 were among people over 60 years old. and more than half of all deaths occur in people of 80 years plus. So in giving this providing information, we have to teach the caregiver along how to take care of this patient, and we explain and provide information in clear and understandable way, and the caregiver may need assistance to learn physical and technical requirement of care, and to communicate effectively, to develop cost-effective plan of care and achieve positive client outcome. So next one, we can see the next slide, please. So now the linking caregivers to resources, with the supportive resources in their natural network as well as formal services. So we have a few group like of the NGO, we have the former caregivers, we have also the family support, the government support. So supportive resources in their natural network as well as formal services. Because the support group help by sharing experiences and information, offering understanding and acceptance, and suggesting solutions to common problem and concern. Yeah. So now this like formal social support system provide housing, then health coverage, finances, and respite care. As you see now, also from previous speaker, Dr. Sandeep also mentioned the government also give some subsidize the reduction, even for what to say, the prihatin, the B40 government will give special allowance for them. So now is again for the elderly, those who really disabled and need financial help, the government will help. Yeah. So respite care also include adult day care. So this is also the roles and the function of the nurse there in the home care assisted living services. So these are the linking caregivers to resources. Next. Okay, intervention to reduce burden and distress. So we have the multi-component intervention like the support group that I mentioned. We have comprehensive counseling session and home visit and enhanced social support. So everybody has their role. We understand in the healthcare professional also, we have very, we have many experts in the support group and also in the healthcare professional with various expertise. So like we have physiotherapy, we have dietitian, we have counselor. So everybody will take their role in the intervention to improve competence and the confidence. So where teach caregiver how to design and carry out plan that focus on medical and psychosocial problem. So perhaps we can bring the counselor. We can bring also some nutrition or dietitian. So this is how teaching how to manage specific patient problem. So in the COVID-19, I am sharing with you what we have now in the home care, in the nursing home. Very few. There's not much of affected as in the hospital. There are more admitted in the hospital, not in the nursing home. As you see, China, they built COVID-19 hospital within 2 months. But Malaysia, we proudly can announce that Malaysia converted the COVID-19 settlement for 2 weeks because they converted one of the center to place and all put the patient of COVID-19 at MIHHICo. That place is the agriculture center near the one of the university. So they converted is to become the hospital, temporary hospital for COVID-19. And now is how they isolate and they quarantine the patients there. So because the potential for harm risk of elder abuse, counseling and support. This is the function and the role of the nurses to ensure that they can solve this problem solving skill and coping skill, especially like the future what to say potential for harm. What can be like medication error? We have to come up to educate about drug, or about the possible side effect and so forth. Okay, next. Yeah, this is the, yeah, I would like to share the video. I hope the secretariat can put on the video just 3 minutes to share our successful story on the video on the, I hope got speaker. No speaker. This is one of the video. They recognize Malaysia ranked first in the world. Okay, and Sungai Buloh is one of the hospital been put and categorized under the COVID-19 hospital, and those nurses and the frontliners, they have to be there and be focused and do the direct patient care. So this is the Sungai Buloh Hospital, and with the COVID-19 patient, so we have taken the proactive measures, and the frontliner, they have to work and get them prepared with all the facilities. Okay, and the top-notch hospital, and this is I can say been given the accreditation, and I am sorry because you can't hear the what is the author telling. Yeah, so this is something is I mean sharing. Actually, I want to share with you the achievement, the success story on the Joint Commission International JCI. They recognize the Malaysian hospital as the top ranking in dealing with the COVID-19. Okay. So this is how about the frontliners. Okay. And they have the in-service calls, and nurses, they have to stay at the hospital, whereby the government have prepared them for the accommodation, the hostel, and some places the hotel been converted into the hostel for the frontliners. So this is what I would like to share with you during the critical situation. Or the frontliner, many they cannot go back, they have to do long hours duty, and this is what the Ministry of Health, and with the support of the government, we make it through. So we make it through to come to the stage now, whereby the protecting of our elders is everyone business. Yeah, this is all about, because Malaysia has since Malaysia has reported a single digit case and for the last 4 days, and hope to announce the stop of the spread of the virus in July, inshallah. So so as part of the COVID-19 measures, it declare as I mentioned, declare a curfew in March, and the normalization process begin June the 10th. Okay. Next slide, please. Okay, so this is the place where I would like to share with you one of the senior citizen settlement, elderly care home. I take the liberty to start is because since I have the background of gerontology, I would like to contribute my professional knowledge and my experience. After I came back from Thailand, I see how the establishment of the senior citizen center there, the elderly care. So this is one of the center at northern area. Okay, so this one near northern area is near Penang, but is not in the Penang, is a northern area. Okay, so here we have a caregiver, we have the former caregiver, we have the nurses who are trained and qualified, and this is the management. And I have another informal caregiver, which are the school leavers. We have the NGOs who come out as informal caregiver to help with this elderly care. So they will come and register, and also they're part of the community work. So in order to get the fund to run this, I take the initiative to propose this um, these activities for the government to give our fund allocation, and those policy maker, the one who have the say, or those who can make the decision, they can come and visit. So once they visit, they can see this is real situation. So the government will support this. So this is how I would like to share with you as a nurse, a role and function of nurse in protecting the elderly. Because some of them, not to say they can't afford, they are staying alone. We do not want them to stay alone, because anything can happen if they stay alone. Might as well they come and stay here, and we can take care of them to avoid any injury or anything harm. Because as I mentioned, this is our tagline: protecting our elders is everyone business. Okay, protecting our elders is everyone business. So again, roles of the nurses to protect: we have to provide opportunities for caregiver to network and establish partnership, and we will provide a forum for exchange of innovative and creative strategy in elderly care with evidence-based practice, education, research, and quality. Those university students, they come and do the research, and they always want to contribute, like community work. They will come to Afala and carry on with the community work. So that is part of the NGO activities and also community services by the student and by the community. And also, we identify the common theme, and we want them to, when we identify the common theme, we will have the gathering, and from there, we will help the elderly to come out who are the independents. They also can assist others. So that's why the rules and responsibility of the geriatric nurse. So in nursing, you have to integrate your advanced knowledge and experience in delivering safe, effective, quality care to geriatric clients in primary care. Because you have knowledge, you have to demonstrate competence in managing the health and status of geriatric clients in primary care. And you will have to manage and negotiate within the healthcare delivery system on behalf of geriatric clients in the primary care. So roles, again, manage and monitor to ensure quality health for geriatric client in primary care. Incorporate and understand of trend in aging in planning and providing primary healthcare for clients. So this is how, as a nurse, you are the change agent. You have to demonstrate leadership and competence in implementing the role of the primary care nurse and practitioner. You also can engage in counseling as your roles and responsibility. Engage in counseling, communication, collaboration, and teaching in a manner that reflect caring, advocacy, yeah, and also we want you to have this as a nurse with expert in the geriatric care or gerontology nurse. Okay, next. So I would like to mention here characteristic of the geriatric nurse. Of course, you have to be expert in a particular field of nursing. We have so many. Um, Field that you as a nurse you can venture, but I at the moment I can share with you, I don't see many nurses love to go for this gerontology. During my class, when I asked how many you like to take care of the geriatric patient, only about 10%. The rest would like to go for ICU, for peri-operative. Yeah, so this is how uh, about expert in particular field of nursing. I hope you can become, many of you like to go for a geriatric nursing or gerontology nursing. In Masa also we have 6-month course. You can take this short course, yeah, and you can also disseminate information rapidly and develop and maintain strong trust and interpersonal connection with staff, peers, patient, and other professionals. And this is how you can build up and support each other. Okay, so yes, so now in working with older patient, a geriatric nurse will assess the patient mental status and cognitive thinking skills, as what Dr. Just now that Sadi, the one of the first speaker, yeah, he talked about how the healthcare and the frontliner can do the assessment. So we have to understand patient acute and chronic health issues. This is how you learn during your training, and when you come to post basic, you again learn on the theory of the aging theory, the aging process, and when you discuss common health concerns such as those major problem and minor problem of the elderly, and how you're going to organize the medication, how you're going to educate the patient about personal safety and disease and prevention. This is again is very important. You as the nurse who are can say uh, specialized in nursing. Okay. So now as the, what to say, as a nurse in working with an older patient, we want to see the quality, quality and safety curricula in nursing education. The photo there that I attached is the photo of my student, final year student. During semester 5, we also cover on the gerontology nursing. So around about 2-3 credit, I mean around 30 hours, and they will be posted to the nursing home, and some will go to the geriatric ward in order to prepare them, because in the healthcare delivery setting, redesigning in the wake of staggering report of severe quality and safety. So that is very important. We want to have the transform of nursing curricula, because as you know, the medical technology and what is the changes, what you do today is should be better than yesterday. What you're going to do tomorrow should be better than today. This is our trademark. Yeah. Okay. So the new graduate most closely must match with the practice need. So when we produce the nurses, it must meet the demand. Okay. So now now we have the gerontology courses for our nurses. Okay. Next. So this and then in the nutshell, I would like to conclude with your roles of the nurses. You can be as a nurse, you can be in the clinical, you can be the clinical consultation, and you can follow up, and you also be a supportive role in the counseling or lifestyle modification, education, enhancement of self management, Okay, and referrals to other specialties and support and social service. That is the care coordination and others like telemonitoring, minor surgical procedure, advanced life support, advanced care planning. All this setting can be in the hospital or can be in the community or in the home or can be teleconference or virtual. So we have also virtual now clinic in Malaysia been established by the Ministry of Health. Okay, next. Okay, as a take-home message, this is what we now practice this and the SOP to follow. We want to remind everybody and we really follow. And if they don't follow, there will be a fine for the people who did non-compliance. 3S and the 3W. S meaning that sesak lah, sesak, tempat sesak. Tak boleh berada di tempat sesak. S yang kedua bermaksud sempit, ya. Cannot be at the sempit area. And S number 3 is sembang. You cannot sembang dekat-dekat. That means you cannot sentuh. You can't be touch. Even you can see now, if when I go back to the university, in the lift, used to be 10, 15 people go inside the lift. Now, with the strict, because of the 3S, we cannot have sesak, we cannot have sempit, we cannot have sentuh. So only 4 people can go to lift, our lift now. It's very, very strict about this. Okay. So the other one about the stay home and stay healthy, the other 3W is you have to wear mask. Okay, wear mask. Pakai pelitup muka. Always wear mask. So you have to wash hand, cuci tangan. This is what we have to practice. And one, meaning that you amalkan etika batuk. That means when you batuk, so that is how we keep on imposing this. If everybody follow, inshallah, so we will win and we will go to the recovery stage. So pandemic is here, not only in Malaysia, not only in Indonesia, everywhere. In US, still they did not recover. They are the leading now, the number 1. Okay, followed by Spain, Italy, and so forth. Even in Singapore, still got highest number. So we want to putuskan, they said, to break the chain. So we have to follow. And our role as a nurse, as a frontliner, is very, very important. Very, very important. Okay. Next one, I would like to share. This is the group of nurses and all the leaders I attended in year 2010 in Geneva, where we still connect each other. We want to know how their COVID-19 at their place. So we are sharing. So sharing is caring. So maybe they have better idea how they combat with the COVID-19. So we also can share. Now, even now, also we can do some collaborative research with them. So that's why the more that you read, the more things you will know. The more that you learn, the more places you will go. So this is what I want to share with you. So keep on connected. There's a lot to learn from each other. Today, I understand 8,000 of you. I'm sure you have a lot of things to share and also a new experience. Okay. And you as a change agent, because the most important now, we want people to understand how to combat the COVID-19, and we have to be the role model, and we have to be the change agent as a nurse. So don't pay attention to what is at the back behind. So what lies behind us and what lies before us, tiny matter. The most important now, what happened now? Now the situation is COVID-19. So how are we going to combat this COVID-19? We have to follow the SOP. So our role, we have to equip ourselves being the frontliner. This knowledge must be with us. and we are the role model. Okay, even you are with the elderly or you with the adult, you are still have to play your role, because roles and function of a professionals must be global. We have a quality nurses with competent and to be a safe nurse. No matter where you are the global nurse, anda mesti competent, you must be a safe nurse. Yeah, this is my message to you. Okay, roles and function of a professional. Next, I would like to end. Thank you for your attention and terima kasih. Yeah. Okay, now I hand over to our MC. Thank you.
Okay, thank you for your explanation, Prof. Zahra. And we will conclude about the topic. I think that's interesting topic today about the role of nurse and protection of elderly groups. Because we have everyone business to care elderly group. And the next session, asking and answer question.
Thank you, Prof. Zahra.
The first question from Dwinda Sari, student of nursing study program, STIKES Mitra Husada Medan. And the question, what's government given to nursing in take care directly COVID-19 in hospital?
Okay, just sharing with you, for the frontliners, during this COVID-19, the nurses get special allowance. They get the extra critical, another critical allowance, which everybody will get another 600. How much? How many rupiah for the Indonesian? You must convert until maybe around 2 juta rupiah. Another extra the government give to the frontliners who deal direct, and now they give them the special what to say, leave. After long hours they get special leave. And the agency like the one I know is like airline and the hotel. Once you declare you are frontliners, they will give you very very good price for you to stay in the hotel now. So when they open this thing, this is how to appreciate the the contribution from the nurses and the frontliners. So that is the latest I can share with you.
Thank you, ma'am. And the next question from Sony, student of nursing study program. And the question, whether any special training for nursing in management emergency COVID-19.
Okay, what we do for the emergency COVID-19, during that time, we have like a master class, meaning that we want to prepare for this emergency training for the COVID-19. We have a special team, the training in-house. Those who are with the direct patient care, we register them, they will get the certificate. So this is our obligation to ensure everybody prepared for this. So there's so many training related to COVID-19 during this MCO with regard to this kind of training that only online. We provide online. There's so many training online, and everything is free. And in the Malaysian Nursing Board also, due to this COVID-19, for this year, next year, they said we don't impose on the CPD point because the nurses cannot come face to face. So they are encouraged to do online, but they also still can renew the license. Before, when to renew the license, they must take the CPD point of 30 to 40. But because of this situation, the nursing board gives some allowance for them to with the frozen first, until the new notice, until the new order. So that is the situation. But still, we want to prepare them for the emergency on the COVID-19. There's so many training providers. Yeah.
Okay, thank you, ma'am. The next question from Anissa Paujia, Nursing Study Program at Mitra Husada, Medan. And the question is, how to maintain good mental health as a caregiver in this pandemic era?
Okay, thank you for the question, and quite relevant. And this question been asked few times, frequent time. And we have, I want to share with you, we have now under the ministry, they have this, they call it hospital mesra ibadah. When they call mesra ibadah, they have one unit, spiritual care unit. So if the nurses need some counseling or spiritual needs, there's also ustad ada di situ. So ada ustad, and in fact, the team in the Sungai Buloh, they have already established, they have 2-3 ustad there to give the counseling, not only to the patient, but also to the nurses who really need to, relieve themselves from the burnout and so forth. So they call it spiritual unit, spiritual unit. So we have this establishment, Alhamdulillah. Does that answer the question?
Yes, ma'am.
Yes.
Thank
Okay.
you for your answer. But
Yes.
we will continue the next question.
Yes.
Okay, this question from Ferdinand Pangaribuan from Stikes Mitra Husada, Medan. Program and nursing. And the question, what disease can cause death in elderly infected with COVID-19?
Okay, I just want to share, as you know, the elderly, their immunity system is very low. And those who infected with this COVID-19, they already got underlying diseases, such as they have cardiovascular disease, respiratory, and diabetes. So when you can see the statistic of those deaths in the country, out of 121, the elderly people, they are already with this kind of underlying condition. So this is what according to the report. So we follow the report every day, daily report by our DG, and they will mention is not because of the infected, but apart from that, they already got other condition. So that is especially the elderly. As you know, the elderly, the immune system is lower, and also they have to have the good mechanism to combat with this COVID-19. At the same time, the underlying condition may cause their worsen to have this infection. That's why as a nurse, I want to share, as a caregiver, they have to help to manage the physical needs, prevent the illness, and treat health condition. So that's why from the nursing diagnosis, you have to do this. They need to observe and monitor the patient, recording any relevant information to aid in the treatment. So from there, if they know like respiratory problem, so they have to take immediate measure. The most important in the elderly, because of the immunity system. Yeah. Okay.
Okay, and the next question, ma'am, from Umar Jamil, Pakistan. And the question one, a person who live pre-lived from 20 years, how is it possible to focus on SOPs like wear mask, feel allergic, or nose or ears? And And the next question, how can electrical engineer can help in this COVID-19?
Okay, maybe I can answer the number 2 first. Because we have the engineering department, engineering school in our hospital. They're the one who provide, you know, the the screening tank. The engineering who provide that for the COVID-19. That one sanitizer. When you go in, you have to screen. That is the role of the engineering people to help in the COVID-19. Yeah, okay. Same like other community, like when they see, this is what sharing with you, when these people, our community, the NGO especially, when they all saw that the nurses sewing the face mask, the nurses doing the PPE, you know, they jahit, they jahitkan face, they buat ini. That's actually not the nurses' job, but because we need the PPE, so we did. So finally, these people, not the engineering and other group, the non-nursing, they take the lead. Come, let us do. So they're the one who help in distributing the PPE. So that is how you help, right? Okay, how you help. So I didn't get the number 1, question number 1.
The question number 1, yeah, a person who lived freely from 20 years, how is it possible to focus on the SUP, and like wear mask, feel allergic on nose or ears?
I think the question is not that clear. I can't.
Okay, the question are a person who lived freely from 20 years.
Yeah, 20
How
years.
is it possible to focus on the SOP, standard operational procedure?
Oh, SOP.
Like
Yeah,
wear
we
mask or
the SOP.
feel allergy.
Yes, we have to follow the SOP. If you are 20 years, if you are at the, of course, maybe we expect the 20 years, the immunity that not that low as compared to the senior. But if you at the crowded area, you still have to put on mask. You still have to wash hand. You have the social distancing. So in Malaysia now, what we practice, the children under 12, they still cannot go to the supermarket and mix around. We want to follow the SOP. Later, when come to the stage that we are comfortable, then the government, the ministry, the government can allow. So even you are 20 years, if you at the place where I mentioned just now, 3S, you still have to follow the SOP. Okay, that is what I meant is, you have to follow SOP, not only for those elderly. Okay? Then they can go, maybe the person may be asymptomatic, but if they feel like, I have this kind of febrile, I have coughing with no reason, they always can go to the clinic and ask to check for screening. So that is will be better. All right? They can always go for the screening test. So we have open the clinic with regard to the COVID test, COVID-19 screening test. And we have many NGOs who volunteer and the agency who conduct this screening test. Yes.
Okay, ma'am, I have the last question from Octaria Christine from Mitra Husada, Medan. How does the Malaysian state encounter the new normal life, especially in the field of midwifery and nurse education related to competence of healthcare practice?
Okay. As mentioned by the first speaker, also I just want to support. In Malaysia, we are still have to follow the SOP. The government, especially the higher learning, did not allow us to go to the university yet. They want to maintain this SOP to reduce the crowdness, and the university only allowed to bring back the final year students who are supposed to be in the practical area. So in the practical area, instead of we used to send 10 students during the attachment, now they allow only 5 to ensure the SOP. That means only 5. And we cannot send more than 5, meaning that we have to have more clinical supervisor or clinical instructor to supervise the student. We used to send 10 students per attachment. Now, because of this SOP, even the midwifery or the nursing, because of the hands-on, we have to follow the SOP, the post-pandemic, the standard guideline come out with the 15 pages. They have to do screening. They have to follow this one distance, social distancing, or the hand washing, and plus to reduce this crowdness, no more as usual ratio, we reduce to 50%. So every ward, we only can send 5 students. Still can send, but reduce the number. Okay.
Okay, thank you, ma'am, for your sharing your knowledge and addition information about the nurse protect in elderly group. And the last I say thank you very much and see you again, ma'am.
Okay. Thank you for your invitation. I really honor to accept this, and I wish everyone a blessed day. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, and the next keynote speaker will be moderated by Mr. Edi Marjuang Purba.
Ladies and gentlemen, we'll continue for the next speaker, Mrs. Siska Suci Triana Ginting, with the title Effectiveness and Participation of Antenatal Care Visit during COVID-19 Pandemic. Has been here, Mrs. Siska? Okay, before we start the presentation, I'd like to read the curriculum vitae of Mrs. Siska Suci Triana Ginting. Mrs. Siska Ginting was born in Medan, Indonesia, 24 of July 1986. Now, she is a lecturer at the head of midwifery program diploma at M.Kes Mitra Husada, Medan. She has obtained diploma from Midwifery Academy of Elizabeth Medan, bachelor degree from Poltekkes Medan, and master degree from Faculty of Public Health, University of North Sumatra. She has excellent work experience and also member of Indonesian Midwifery Association. She has published several research papers and produced books related to midwifery. She has done research related to the midwifery, and the last research is utilization of home care with the acupuncture technique to accelerate post-section postpartum wound health processing Mitra Husada, Mitra Sejati Hospital, Medan City. Ladies and gentlemen, I'd like to welcome Mrs. Siska Suci Triana Ginting. Now, time is yours.
Okay. Thank you for Master of Ceremonies. Good day for all. Let's introduce myself. My name is Okay, thank you. My title of presentation, effectiveness and participation of antenatal visits during in new normal COVID-19. That we know that are currently experiencing the COVID pandemic 19, and we know that pregnant women will remain a priority. So I wanted to the situational analyze from the picture. It appears in red indication the distribution of COVID in red zone. So we must have a strategy of antenatal care. The intervention must still be made with adjustments when the pandemic COVID-19 so that the red zone at maternal death does not get worse and the yellow or green zone on maternal death does not turn red. So this is the date of the 16 April 2020 that is the distribution of COVID case 19. The size of the circle shows the higher confirmed cases of COVID-19 surge. Next. The problem faced by pregnant mother in the pandemic of COVID-19, mother and family knowledge related to COVID-19 and antenatal care for the pandemic era. Not all health workers had been socialized with guidelines for the service of pregnant women in the pandemic era. The regular service at the public health center, independent midwife practice, and integrated healthcare center still carried out normally at some areas. The need and the availability and fulfillment of PPE, the personal of protection equipment. The high number of COVID-19 cases treated by referral hospitals has an impact on the flexibility in handling maternal and neonatal referral service. Select the quality antenatal care. The first at least one time at the beginning of pregnancy examination by a doctor for screening health problem and screening for preeclampsia risk. At least once at the beginning of the second trimester, examination by the doctor for early detection of maternal health problems that arise and ultrasound obstetric screening for early detection of abnormality in the fetus. And the third, at the twice in the third trimester examination held by doctors for birth planning. Antenatal activities, can you see that the first examination of first visit and subsequent visits to determine gestational age of first visit and recognize the risk of medical complications, especially at the first visit, obstetric complications in pregnant women in accordance with the standards contained in the MCH handbook. MCN handbook in the mother and children health. 2. Make recommendations from antenatal for future care or referral by doctor or can continue antenatally at the place of service. 3. The family planning, counseling and service including planning for future pregnancy. Next. Nutrition consultation in pregnancy. Meeting macro and micronutrients needs. The maternal health antenatal care service in pandemic era COVID-19. Antenatal health service in the COVID-19 pandemic era, the safety of the healthy workers should be forgotten so that adjustments are needed so that both health workers and patients avoid transmission. The primary and referral health facilities must be fully prepared in fueling personal protection equipment like face shields, gloves, and goggles and glasses, drones, head covers, masks, respirators, and shoe covers. Infrastructure and human resources need to map health service facilities capable of providing maternal service during the COVID-19 pandemic. Strengthen the ability of the midwife's independent practice to detect complications or risk factors for pregnant women so that planned referrals can be made. The government or central and regional contribute the affordability of PPA since it is not covered in GKN financing. And the last, utilization of other referral information system applications in ensured to be always ready to support maternal and neonatal reference in COVID-19 pandemic era. Antenatal care health service when pandemic. I explained about the pregnant mother. The first, after checking the first pregnancy by making a doctor's appointment, daily checking the next pregnancy, and do an antenatal care in the third semester months before its PIL, estimated birthday. And use the MCA book as a counseling, information, and education media. Use the communication media for consultation. The pregnant woman, families, and cadres who play an active role in receiving danger signals. The fourth, make an appointment if there are complex conditions that require inspection handling. The filling of P4K stickers in Great Stroke communication device. And the last, postpone pregnant mother places. Antenatal care for risk factor screening, make an appointment so you don't have to wait long. To postpone the second trimester antenatal care can be through teleclinical consultation unless there are danger signs. And the third trimester pregnancy examination must be done 1 month before the estimate delivery. The filling of P4K stickers in by midwives, nurse, or doctors through communications. Study the MCA handbook and apply it in everyday life, including recognizing danger sign. That you have, the danger sign, we must control it. Checking himself, immediately go to health facilities if there are risks or danger sign. Make sure the fetal movements begin at 20 weeks gestation. After 28 weeks of pregnancy, count fetal movements, minimum of 10 movements for 2 hours. And postpone pregnant mother's class or take mother's class online. Main recommendations for health management that handle pregnant mother COVID-19. Continue to prevent transmission of COVID-19. Keep a minimum distance of 1 meter if new action is needed. Use the appropriate personal protected equipment level. If there are acts of opening the mouth or that cause aerosols, use an N95 mask. Place the patient with COVID-19 or PDP in a special room. The babies born to mothers with COVID-19 are considered as PDP and placed in isolation. Prepare spirit care facilities for mothers with COVID-19 or PDP confirmed with their babies to reduce transmission. And reparation of postpartum patients according to recommendation. Next. Ideal condition for healthy pregnancy for pregnants. The first, age between 20 until 35 years. Normal nutrition status or body mass index in 18.5 until 25. 3. No cake or lack of protein energy. This is upper arm circumference in the more than 23.5. No anemia. Number of children less than 3. The distance between pregnancy is 2 until 3 years. Do not have chronic disease such as high blood pressure, diabetes, cancer, psychiatric problems, etc., or disease under controlled conditions. Do not have infections, disease, and sexually transmitted disease such as pulmonary TB, malaria, STS, HIV, etc., or disease under controlled conditions. Do not have the same family history of hemophilia or thalassemia between women and men. Thank you. Until here my presentation, I'll come back to Master of Ceremonies.
Thank you, Mrs. Siska Triana Ginting. It's very nice, very grateful for sharing for knowledge and also information. But before we continue to the question sharing, I want to read the good statement from Umar Jamil in the chat room. I think it's a good statement. He said that work is thankful to the Medical Institute, doctors, cute nurses for helping us in this unblessed era of time. Your sacrifice and caring is grateful. So it's the very great statement from the Dr. Jamil from Pakistan. And now we'll continue to the next question, to the next sharing. The question one from Putriani from Indonesia.
Okay. Okay, I want.
Once more again, I will read the question. From Putriani, its question is, how is midwife support for antenatal care?
Okay. Thank you for question. We as health workers must be at the forefront in carrying out antenatal care service while continuing to provide service to pregnant women who are afraid of COVID-19. So feel safe in conducting examination in the normal COVID-19. So you can use a PPA like operational, either face protection, and control the antenatal care for the increasing of the maternal. Thank you.
Thank you, Mrs. Siska, for your answer. And the next question is from Rafti Sumawi from Stikes Mitra Husada Medan. The question is, what is the strategy for protective equipment for pregnant women?
Okay, thank you. The strategy is must be the forefront. Immediately, we can use equipment protect to our workers to give service help for the mother healthcare. We not forget to find the face shields, gloves, goggles and glasses, gowns, head covers, masks, respirators and shoe covers. And we can use the mother's class online. I think this the strategic. So we must have do it the service of the maternal for the not afraid of the COVID-19. Thank you, sir.
Thank you, Madam. We have the next question. The next question from Free Rido from Nusa Tenggara Timur, Kupang. What the kind antenatal care service in the pandemic will bring priority for the maternal?
Okay. Thank you. At least they continue to prevent transmission. Keep a minimum distance of 1 meter. As we have a health service for the mother care, and don't forget use the appropriate PPA and place the patients with COVID-19 in special room if have the infection. But if they're not infection, we just take a mother's class online, and after we can to follow to home door to door of the service of maternal health care. I think that's sir.
The next question I will repeat from Selvi Indah Saputri. The question is, how do we as midwives cope with a pregnant woman who does not want to take health protocol in handling antenatal care?
Okay, thank you. The next question, yeah. I have asked the questions. The first time, don't forget to keep a minimum distance, 1 meter if no action is needed. Don't forget to use the personal protective equipment level and use the max and 19.5. Place the patient with COVID-19 or PDP in a special room, and babies born to mother COVID-19 are considered and placed in isolation. The prepare separate care facilities for mothers with COVID-19 or PDP conflict with their babies to reduce transmission. So we can use that reduced transmission for the COVID-19. Thank you, sir.
Thank you, Mrs. Siska Suci Triana Ginting, for your time and for your willingness to share your information and knowledge. Hopefully, your sharing give benefit for our participant. Now we are going to the next speaker and will be moderated by Mr. Zulkarnain.
Okay, thank you. For Mr. Eddie. And the next, we will continue for the speaker, Mrs. Febriana Sari, with the title, Roles and Responsibilities of Health Workers in Promoting of Breast Milk. Before we start the presentation, I would like to read curriculum vitae of Mrs. Febriana Sari. Mrs. Febriana Sari was born on Bandar Hantaran, Indonesia, the 3rd of February 1990. Now, she is a lecturer and the head of midwifery program, Bachelor of Stikes Mitra Husada Medan. She has obtained diploma get from Midwifery Academic of Mitra Husada Medan, bachelor degree from University of North Sumatra, master degree Mayor Midwifery from College of Health Science Asia, Yogyakarta. She has excellent work experience and also member of Indonesian Midwifery Association. She has published several research papers and produced books related to midwifery. She has done a research related to midwifery, and the last research is effect of lotus birth and increase to hemoglobin and hematocrit level in newborns. Ladies and gentlemen, I would like to welcome Mrs. Febriana Sari. For Mrs. Febriana, time is yours.
Okay, thank you, Master of Ceremony, for the time given to me. My name is Febriana Sari. I am a lecturer in Mitra Husada Medan College of Health Science, and now I am head program study of Bachelor in Midwifery. I will sharing about this topic, rules and responsibility of health worker in the promoting of breast milk. According to Labor Law Health number 36 of years 2014, health worker is every person who devotes himself in the field of health and has knowledge and or skills through education in the field of health, which for certain types require authority to carry out health efforts. Now, this is description case of coronavirus in Indonesia. The number of coronavirus infection continues to spread to a number of countries, including Indonesia. Anyone can get this virus. Breastfeeding mothers are no exception. So, how the impact of this virus on mothers and babies? Indonesian ranks to 28 from various countries. Search from World Health Organization. COVID-19 has been declared as world pandemic by WHO 2020, and Indonesia pandemic COVID before March 2020. Next slide. Okay. In Indonesian pandemic COVID before March 2020. Next, due to an increase in case and spread between region, the government issued regulation concerning large-scale national restriction in Indonesian called PSBB. Start May, March, April, and May. Now, this is transition period, June until now. We have continuity, safe, health, and productive. Is role health workers in supporting of breastfeeding? Social restriction during the coronavirus pandemic or COVID-19 cause concern and stress for many people. However, parents with infant and children have other concern regarding adequate protection for their children. This makes mothers afraid to breastfeed their babies. We know breast milk is the best source of protection and nutrition for children because it contains important antibodies and other nutrients that can help the baby's immune system fight infection. Pregnant and lactating women fall into category that is susceptible to COVID-19 coronavirus. One reason is that they have low immunity due to hormonal changes during pregnancy breastfeeding. Therefore, pregnant and lactating women needs to know how to protect properly during this pandemic. Indonesian vision speech of the President of Indonesia. Indonesia is superior. There must be no stunting, infant mortality, increased maternal mortality. So, the starting point of human research development begins with ensuring the health of pregnant women, the health of infants, the health of toddlers, the health of school children, because it is a golden age to print humans. Midwife and the others health workers have partners to develop interprofessional education and collaboration learning activities that can be adopted by other programs with the goals increase collaboration care models and ultimately improving perinatal until postnatal care. In midwifery care management, midwives provide holistic and comprehensive care, ranging from promotive, preventive, early detection of complication of non-communicable disease, ranging from integrated antenatal care, normal delivery care, postpartum care, newborn care, infant, toddlers, to reveal its necessary and collaboration in continuity intervention. Next. The International Conference of Midwives is concerned that the human right of women, their babies and their midwife are being violated by the introduction in many countries of inappropriate protocol for management of pregnancy, birth, and postnatal care in response to the COVID-19 pandemic. This response inappropriate protocols are not based in current reputable evidence and are harmful to women and their babies. Next. Next. COVID-19, now snowborn, can attack anyone without exception, including pregnant women, breastfeeding mother, and children. So, during the COVID-19 pandemic and facing the new normal era, health service must continue to run optimally, safely for patients and healthcare workers with various adjustments based on COVID handling guideline or health protocol. Challenge of health service in COVID-19 pandemic periods. The first, mother's knowledge and families related to COVID-19 and health service for mothers and newborns in the pandemic era. Mothers really need to continue to get support. In normal situation, giving birth and caring for a baby can cause stress. The success of breastfeeding will increase if the mother gets support from the family. The second, not at how women workers have been socialized in the guideline for maternal and child health service. In the third, in the pandemic era COVID-19, both primary health facilities, states and reform must be fully prepared in fulfilling personal protective equipment. The fourth, the safety of midwife and patient must be protected. Use the mask, surface adjustment are needed to avoid transmission. And then access to health service in pandemic has changed primary health facilities limit service. The high number of case COVID-19 patient being treated of the referral hospital affect the handling of maternal and neonatal referral service. The rules as an educator and counselor. Educator, dissemination and education on the importance of exclusive breastfeeding very needs to be encouraged and emphasize that exclusive breastfeeding is safe for infants, including for mothers who are positive infected by the coronavirus, the cause of COVID-19. Of course, by complying with existing health protocol. As a counselor, the success of breastfeeding not only requires the role of mothers, but also the role of health worker. The role of lactation counselor is also important because it is expected to be able to foster to trust and motivation of mothers to find out more about exclusive breastfeeding. But it is also needs support and the role of the husband or father and the baby itself. Protocol service apply. There are no complaints about applying the content of the mother and child or Indonesian KIA book. And then conduct independent monitoring if there are complaints, sign or danger to the mother or newborn immediately to a healthcare facility. If there are signs of danger, immediately consult a health worker. Postpartum and newborn service by appointment via telephone or WhatsApp and the others. Postpartum and newborn consultation, lactation counseling, baby's growth and development monitoring carried out online. To family planning service are still carried out according to schedule with appointment using the long-term contraception method. Postpartum and newborn service are carried out according to standard using level 1 personal protective equipment and implement the COVID-19 prevention protocol. Postpartum mothers, chaperones, and all time in charge of using masks and implementing COVID-19 prevention protocol. Perform a comprehensive assessment according to standard, which COVID-19 vigilance health worker can coordinate with village head about the status of the mother, people with symptom or OTH, insider monitoring or ODP, and patient under supervision, Indonesian called PDP. Next. Postpartum mothers, chaperones, and all firm in charge of using masks and implementing COVID-19 prevention protocol. Perform a comprehensive assessment according to standard with COVID-19 vigilance. Yes, with village head about status of the mother. I say that people with symptom or OTH, insider monitoring, or ODP, and patient under supervision or PDP. Close contact early exclusive breastfeeding help a baby to thrive. A woman with COVID-19 should to be supported to breastfeed safely. Hold her newborn skin to skin and share room with your baby. Next slide. A woman with COVID-19 can breastfeed if they wish to do so. They should practice respiratory hygiene and wear a mask. Wash hands before and after touching the baby. Routine clean and disinfect surface. Despite having coronavirus symptoms such as a fever or cough, the mother can still breastfeed. The benefit of breastfeeding far exceed the risk of transmission. If a mother feels too sick and unwell to breastfeed, she can be supported to safely provide her baby with breast milk in other ways, including expressing milk, reflectation, and donor human milk. If this is still not possible, babies can receive breastfeeding donation. Main recommendation of health service during the situation of the crisis spread of COVID-19. Number 1, make sure all equipment and supplies have been disinfected. All services are cared about by prior appointment via telephone or WhatsApp. Washing hands with soap and running water according to standard before and after taking action or touch the baby. Make sure to use personal protective equipment according to service standard. Must apply to principle of prevention of COVID-19 transmission. Keep a minimum distance of 1 meter if no action is needed. And all patient and healthcare contacts with using masks as needed. And then, if not really with personal protective equipment according to service standard and it's not possible to provide service, immediately collaborate with the health center or hospital. Conduct a comprehensive assessment according to standard, including information relating to the vigilance of COVID-19. If necessary, can communicate and coordinate with the village head or local regional leaders, especially information about the status of the mother, whether include in the period of dependent isolation before providing service. And then service for pregnant, childbirth, and postpartum, newborn, as well as reproductive health and family planning in the pandemic situation. Two guidelines from the Ministry of Health. Under no circumstance can guarantee protection procedure airway and prevention transmission by contact, then baby given breast milk. under no circumstance can guarantee no babies born to PDP or mothers COVID-19 confirmed given breast milk pump. Outdoors health service is carried out by adhering to the principle prevention of infection control and physical distancing. Outdoors health service is carried out by adhering to the principle prevention of infection control and physical distancing. If implementing posyandu for meet strength recruitment as for local government provisions, restriction on the number of people required health worker, carers, and children and parents. Carers help ensure that with screening low body temperature and no symptom as cough or cold. For information and education, health workers who have difficulty in referring or not allowed must provide education, information, communication. Number one, treatment that can only be obtained at the hospital. There is a risk of not referred to both the risk for the baby and the risk for the patient surrounding, and then risk the worsening of symptoms to risk of death. If need, contact to the local health service. The clerk prepare a statement of refusal of referral if force is requirement. For information and education counseling material, you can call this number in Indonesia and download the link below this. Encouraging and kind words for all mothers to follow for positive affirmation. We breastfeeding mothers are free of the coronavirus. We and babies are perfectly healthy both physically and mentally. Day by day, we and the baby is getting healthier and stronger. Breastfeeding mothers stay calm and don't panic. I'm healthy. Allah protect me and my family. Welcome to the new normal, and I say thank you. Thanks for your attention. Until here my presentation, I will come back to Master of Ceremony. Thank you.
Okay, thank you for Mrs. Febriana Sari to share your knowledge and experience about the rules and responsibilities of health workers in promoting of breast milk. And now we will continue with asking and answer question. For the question one, from Desi Malau, a student of M.Kes Mitra Husada, Medan. The question is, what are rule midwives in supporting breastfeeding?
Okay, thank you. Midwife as a health worker. Midwife have a vital role to play in educating mothers and other caregivers about infant and young child feeding. It's also their moral, legal, and professional responsibility to protect, promote, and support optimal feeding. However, health worker and as midwife and healthcare facilities throughout the world are used by companies to promote breast milk. Midwife and the others health worker have partnered to develop interprofessional education and collaboration learning activities that can be adopted by other programs with the goals of increasing collaborative care models and ultimately improving perinatal until postnatal. And then the rules, a midwife as a educator and counselor. Yeah. The success of breastfeeding will increase if the mother gets support from the family. So it also needs support and the role of the husband or father of the baby itself in order to increase the production of breast producing hormone for mother. Okay, thank you.
Okay, thank you, Miss. The next question from Octaria, student Stikes Mitra Husada Medan. The question is, how, if a mother is sick and has symptoms of the coronavirus, can she breastfeeding?
Okay, we know breast milk is the best source of protection and nutrition for children because it contains important antibodies and other nutrients that can help the baby's immune system fight infection. All evidence show that breastfeeding is very safe. In fact, this virus has never been found in breast milk. So, we want to encourage mothers to continue breastfeeding babies. If um, if a mother is sick and has symptom of the coronavirus like this, despite have symptoms such as fever or cough, the mother can still breastfeed. The benefit of breastfeeding excite the risk of transmission. However, of course, you have to follow all recommended practice to prevent transmission from mother to baby or the other people. This practice include washing hands with soap for at least 20 seconds and then wearing a mask and cleaning the surface touched by a sick person. But if a mother feels too sick and unweak to able to breastfeed immediately, then as much as possible, she can milk her milk. She can the pump breast. Breast milk is given to baby, either by the mother herself or with the help of others using clean cups or spoon. If this still not possible, and if it is culturally acceptable, babies can receive breastfeeding donation. Okay, maybe enough. Thank you, sir.
Okay, ma'am. The next question from Muhammad Asari, student Stikes of Mitra Husada Medan. What is the mother action as a midwife when she is carrying out the task of handling COVID patient, while the mother is nursing the baby's mother because the baby is vulnerable for the coronavirus?
Sorry, sir. I searched a question for Muhammad Asari. Mana dia? What is the mother's action as a midwife when she is carrying out the task of handling COVID patient while the mother is nursing the baby's mother? Because the baby vulnerable to the coronavirus. Right, sir, in this question?
Yeah, I think that's enough for question and answer section. Ma'am, thank you for your knowledge and answer the question. And the next, we will continue, and the next section will be moderated by Mr. Edi Perjuang Purba.
Thank you, sir. We will continue to the next keynote speaker, Mrs. Marliani, with the title COVID-19 Prevention Behavior in Children. Mrs. Marliani have been here? Okay. Before we start the presentation, I'd like to present the curriculum vitae of Mrs. Marliani. Mrs. Marliani was born on Karanganyar, Indonesia, 2nd February 1980. Now she is a lecturer and vice chairman of College of Health Science Mitra Husada Medan. She has obtained diploma GET from Nursing Academic of Delhi Husada, bachelor degree from University of North Sumatra, and master degree from College of Health Science Helvetia. She has excellent work experience and also member of Indonesia Midwifery Association. He has published several research papers and produced books related to the midwifery. She has done research related to the midwifery, and the last research is factor related to the completeness of antenatal care visit to Linda Silalahi Clinic, Pancurbatu Sub-District. Now, for Mrs. Marliani, time is yours.
Okay, thank you for the master ceremony, for the time given to me. Assalamualaikum warahmatullahi wabarakatuh. Good day and the best wishes for all of us. On this occasion, I will present the material with the title is COVID-19 Prevention Behavior in Children in Medan City. The first, we will acquainted with Corona. Of course, all of we has know about Corona. Next. Corona means crown. If you look the picture, it is pointed like a crown. They are so small, so we cannot see them. Coronavirus is a group of viruses that can cause disease in animals or humans. Next. Coronavirus are known to cause respiratory infection in humans, ranging from cold, cough to more serious can cause respiratory syndrome. What is COVID-19? Coronavirus 19 is a newly discovered disease. Was first discovered in Wuhan, China in end of December 2019. Coronavirus disease 19 or COVID-19 until now. How COVID-19 spreads? COVID-19 spread through a splash from the nose or mouth that comes out when a person infected with COVID-19 coughs, sneezes, or talks. We can be infected with COVID-19 if we breathe in a spark of a person infected with this virus. So, it is important for us to maintain a distance of at least 1 meter from others. These spaces can stick to objects and other, such as tables, door handles, and handrail. We can become infected by touching an object or surface, then touching our eyes, nose, or mouth. Next. What are the symptoms of COVID-19? The most common symptom of COVID-19, fever, dry cough, and fatigue. Some patients may experience include excess and pains, nasal congestion, headaches, conjunctivitis, sore throat, diarrhea, loss of scent or smell, skin rashes, or discoloration of finger or toes. Development of COVID-19 case globally. Confirmation case as June 25, case with 479,133 deaths in 215 affected countries. In Indonesia, data from National Disaster Management Agency from June 26, people under supervision, patient with supervision, there is still an increase in case. Patient positive increase be 1,427 and patient death increase 2,683. This case happened in 448 district or city at 34 provinces in Indonesia. Next. Okay, thank you. In the city of Medan, North Sumatra province, we can see a patient positive after a rapid test increased 1,287. I get data from June 24, 2020. Next. Child respirological consultant from Indonesian Pediatrician Association COVID-19 Task Force said the percentage of COVID-19 children in Indonesia from the Ministry of Health data is 7.5%, although not as much as case in adult, overall relatively higher compared to other countries around 1 to 5 persons. One of the factors that cause the child mortality due COVID-19 in Indonesia as lower immunization coverage and higher stunting rates. In Indonesia, there are 15,428 confirmed, including case 1.4% of under 5 children. Of the 11,123 in care, there were 1.6% of children under 5 treated or isolated. Out of 3,218 recovered, 1.2% were under 5. And from 1,028 died, there are 0.7% of children under 5 died. Based on the official release of Association Pediatrician, as of May 18, there is 584 children tested positive for COVID-19 and 15 of them died. Totally 129 people from 3,324 child. Spokesperson for the North Sumatra COVID-19 Acceleration Handling Group, Aris Yudariansa, said the case of children exposed to COVID-19 in North Sumatra province reached 3.6% of the total case. From the data above, we see that the COVID-19 case in Indonesia is quite high. So we have to take steps or behavior for COVID prevention. The first, parents or caregivers wash their hands before and after caring for children. Leave the house, wear masks when caring for the children. Children always stay at home. If forced to leave the house, wear personal protective equipment. Still pay attention to keep a distance, avoid the crowd, and immediately take a shower, wash your hair, change clothes when you get home. And for children under 2 years old, are not recommended to wear masks. We must be careful because risks of suffocation and the children difficulty breathing. Familiarize children wash their hands before eating, after urinating, before and after doing activities. Example, playing, touching animal, etc. And use hand sanitizer is only an alternative of running water are not available. For example, if it is far from hand washing facilities. Remind children not to touch their eyes, nose, and mouth before washing hands with soap and running water. Disinfect objects that are frequently touched, such as furniture, door handle, toys, device, and other with disinfecting regularly. We can implement infection prevention practice with interesting method for the children. So we can follow you. Example, wash your hand with clean water and soap while singing, sneezing, coughing. Use a doll to show how to cover the mouth with elbow or tissue. And don't forget, consuming family food that meets balanced nutrition, encourage children to exercise regularly. For children aged over 2 years, we must teach them how to wear a mask. Children to wash their hands before and after wearing a mask. Make sure the mask cover the mouth, nose, and chin like this. Yeah, maybe like this. Yes. Avoid touching the mask when wearing it. Have children wash their hands if touching the mask. Take off the mask by only touching the strap to wash it immediately. Next. And we have know about new normal. Indonesia is currently entering a new normal period. The term new normal appears after President Joko Widodo stressed that community must compromise, coexist, and make peace with COVID-19 in order to remain productive. May 17, 2020. Next. Okay. So we must know about guide to implementing schools in new normal. Health screening process for teachers and school administration. If employees with weak or decreased immune system or are ill are not advised to teach or work in school. Recommended for them work from home or a student study from home. Zone of residence location screening. If they staying around the red zone, okay. No, before, okay, thank you. Teacher employees who pass the screening stage are marked. Before teaching and learning activities take effect, do virtual socialization of new patterns to parents, students, teacher, and school staff. Set the time of teaching and learning activities. The time of learning activities is arranged so as not to coincide with the time of heavy traffic and reduced duration at school. Number 7, data and check condition. Class teachers are required to record and check the condition of students and parents virtually as an initial screening. So, the administration school must sitting position. The sitting position is set to a minimum of 1.5 meters. The teacher doesn't switch classes. And keep the distance. Teacher keep distance with the students and is not mobile. Screening before leaving if the temperature is above 38 derajat Celsius, cough, runny nose, don't go to school or work at school. Not gather. Parents or deliverers are quite out of school, forbiddenly together, just stop, drop off, and then leave school. And next, physical screening. Application of new school pattern rules includes mandatory wearing masks, adjusting the distance, not touching, washing hands, providing sinks and hand sanitizer in various school locations. Corona prevention information. If the school is active or other public place are required to post a notice board about coronavirus. And then disinfectant, keep the classroom clean. Study tables and chairs with disinfectants every day. Close the playground. Teacher, employees or student return from out of town and abroad or given work from home or study from home for 14 days. Prepare daily health, school, and psychological support at school. Government are required to regularly drop medical personnel to school. Also, regularly sampling is done at school. Maybe it's all our presentation. Thank you for all audience, and back to master ceremony. Thank you.
Thank you, Mrs. Marliani, for your nice and great sharing. You have shared the information and also knowledge and experience. Now we are going to the next section. It is the question and answer section. The first question from Mutiara Asia Putri from Stikes Mitra Husada Medan. This question: What should be done if the child has symptom of COVID-19? Thank you.
Okay, I will answer the question from Mutiara. The first, we must recognize the danger signs or signs of sick toddlers, such as shortness of breath, continuous diarrhea or vomiting, severe pain in the stomach. Delay taking the child to a health facilities unless it is an emergency. If still in a light state, do isolation at home as long as it doesn't endanger for other family members. Maybe it's our answer, sir. I'm sorry, I can't hear you, sir. Mr. Eddie, I'm sorry.
Okay, the next question from Lindang Tumalko from Nursing Study Program, Stikes Mitra Husada Medan. The question is, what has been done by the government to prevent COVID transmission 19 in children in Indonesia?
Okay, thank you for the question. I will try to answer. The government has made a policy or regulation that new school years starts on July. To junior and senior high school. September for elementary school, and to the kindergarten at December. If this has been carried out, all students must follow the health protocol established by the government, such as use masks, wash hands, physical distancing, sitting position in the class, and don't forget always wash a hand with soap, etc. Sir, like them. Okay, thank you. Maybe enough, sir. Sorry, sir, your voice I can't hear.
Okay, thank you, madam, for your explanation. We have one more question. The last question for you from Ini Izati from Misbahul Ulum College. The question is, indirectly, social capital is very helpful for government work in tackling a pandemic. How do we sustain the social and mental burdens of this pandemic? Thank you.
Okay, from Izati, yes. Social capital is very helpful for government work in tackling a pandemic. How do we sustain the social and mental burden of this pandemic? Okay. In new normal, the government has been rules. We must work to increase our life, so we must follow the protocol health for government. So we must take careful. Don't forget, use masks from home and physical distancing if you stay at the office. Maybe it is my answer, sir.
Okay, thank you, madam, for the answer and for explanation to the other participant. Thank you very much. So many information that we got from you. Now we are going to the next speaker and will be moderated by Mr. Julkarnain. Thank you.
Okay, thank you for master ceremony. Good day.
Ladies and gentlemen, the next keynote speaker is Mrs. Rosmega Pakpahan with the title Home Care for Elder People During the COVID-19 Disease Pandemic. Before we start the presentation, I would like to read curriculum vitae of Mrs. Rosmega Pakpahan. Mrs. Rosmega Pakpahan, she was born on Sibolga, Indonesia, 28 October 1962. Now, she is a lecturer and the nursing program diploma at M.Kes Mitra Husada, Medan. She has obtained bachelor degree from Faculty of Nursing, University of North Sumatra. Master degree from Faculty Public Health, University of North Sumatra. She has excellent work experience and also member of Indonesian Nursing Association. She has some publication related to nursing research. Now, I would like to welcome Mrs. Rosmega Pakpahan. For Mrs., time and place is yours.
Yeah. Thank you. Yeah. Thank you for master ceremony. Yeah. Yeah. Good day, ladies and gentlemen. My name is Rosmega Pakpahan. I am from Sikas Mitra Husada, Indonesia. Yeah. I'm going to talk about my title, in home care for elderly during the COVID-19 pandemic. The COVID-19 pandemic is impacting the global population in drastic way, and in many countries, older people or elderly are facing the most serious threats and challenges. Although all age groups are at risk for contracting the COVID-19 virus, elderly face a significant risk of developing severe illness due to physiological change that came with aging and existing underlying health condition. This pandemic has brought about unprecedented fear and uncertainty, especially among older adults. To take care of elderly or even our own family must familiarize themselves by doing home care. Home care is care that allow a person with special needs to stay in their home. In home care can help someone who is aging and need assistance to live independently or is managing chronic health issues. Professional caregivers such as nurses, aides, and therapists provide short-term or long-term care in the home. Home care can be decay to achieving the highest quality of life possible. It can enable safety, security, and increase independence, especially when COVID-19 pandemic that happen right now. One kinds of professional healthcare like us or nurses hopefully can educate and socialize people and home care service done at home. Why we must care about them or elderly? Older people or elderly are at highest risk from COVID-19. Yeah. Here, I have present some data about percentage of elderly infected with corona-19 virus. First, in United States, Center for Disease Control or Prevention or CDC has information for older adults at higher risk. Around 8 out of 10 COVID-19 deaths reported in the United States have been in adults 65 years old and older. Visit CDC government coronavirus post step to reduce your risk of getting sick. The second, in Italy, for the age group 60 until 67 years, around 8.55%, and the height has around 42.71% at 18 until 89 years. Yes, the percentage is really surprising. In Indonesia, with the latest I get age group more than 60 years infected with coronavirus, around 40.7%, and the death percentage is 43 0.5%. It is higher than I think percentage. Yeah. Now, what can we do? How to take care of elderly during COVID-19 pandemic? You may worry if you are caring for an elderly loved one who is at home. Here are some guidance you may need to know to keep elderly people at home safer and what to do if they get infected with COVID-19. The first, assessing the risk for COVID-19 in elderly around age 60 until 70 years, 70 until 80 years, above 80 years, risk increase with every decade. Associated comorbid condition, pre-existing medical condition like diabetes, high blood pressure, heart problem, lung problems, underlying cancer, HIV, or any other immunodeficiency condition. The second, mitigating risk of COVID-19 in elderly around, minimize the contact of elderly with other members of the family. Ensure only one person dials with them at a safe distance and that their food is also served with cautions. Avoid any visitors for the elderly. Avoid any outdoor activity like walking, going to grocery, etc. Report any new symptoms as soon as possible. Do not wait for things to worsen. The third, handling new symptoms or problems. Report all new symptoms immediately. Elderly do not get high fever and may not get the classic signs as we see in young people. Any cough, breathing difficulty, change in smell or taste function, lost motion, etc. are symptoms associated with COVID-19 pandemic. They must be immediately reported to your home health doctor via tele, consult, or call. And the last, ensuring emotional well-being. For example, keep them active and positive. Around yoga or meditation can help. Revisiting memories, watching old pictures, letters, and videos. Using social media to video or call with family, friends on a daily basis. And I hope you can do our best to take care of elderly or even our parents is support for elderly, their families and their caregiver is an essential part of our comprehensive response to the pandemic. During times of isolation and quarantine, other people need safe access to nutrition, food, basic supplies, money, medicine to support their physical health and social care. Okay, thanks all my presentation. Thank you so much for your kind attention. Master ceremony, please have your time. Thank you.
Thank you, Mom, for sharing your nice and interesting topic about home care for older people during the COVID-19 disease pandemic. And now we will continue in this section, asking and answer question. The question one from Uni Ulina Sinurat, student of Stikes Mitra Husada, Medan. And the question, speaking of home care for elderly during coronavirus pandemic, why the home care is meant to do by the family? But in Europe, home care can be managed by special organization. Example, in Indonesia, we call it by panti jompo. Why? So, why the family, ma'am?
Okay, thank you for questions. Oni Ulima Sirait. Yeah. I will answer. Okay, you know that entering old age is not easily accepted by someone, especially with physical change and health problem, right? Of course, it has to be the family. Family supports so the quality of relationship that can have positive impact and can be reflective in warmth, security, trust, positive effect, and responsiveness. Elderly quite warm in the family to give them a feeling of caring, comfort, attention, care, support, and love. It is the time where the role of the family to have a positive influence or the elderly family can restore the confidence they lost because of the physical condition they experience. So they feel value, care for, and fulfill all they need. This can improve the optimal quality of life of the family is home. Home, because home is where all family you love life. Okay.
Okay, thank you, ma'am, for the answer. The next question from Muhammad Asari, student of Stikes Mitra Husada, Medan. The question is, now government has assigned a new role. It is a new normal. Do you think what kind of activities of elderly can do to adjust themselves with the new normal?
Okay. Thank you for question, Muhammad Azari Sirait. The new normal is a scenario to accelerate the handling of COVID-19 in health and socio-economic aspect. They are applied in several countries, including Indonesia. Even though the COVID-19 pandemic has not yet passed and new normal life will work, everyone, including the elderly, must pay attention to help the maintain immunity. Activity such as exercising and taking health supplements are always the main thing when the COVID-19. pandemic and new normal life to prevent coronavirus infection. Elderly need to have regular health checks to be able to stay healthy and independent, and also need to pay for consumption of balanced nutrition food. Doing exercise is very important, but they must promote the principle of safety. Then, during the COVID-19 pandemic and new normal, it can be done. It can be done at home.
Okay, thank you, ma'am. And for the last question from Linda Sari. The question is, I want to ask your personal opinion. Do you think when the coronavirus outbreak will end?
Okay, thank you. Will Sari for questions. I will answer. It is an unparalleled global response to a disease. But when will it end, and when we'll be able to get on with our lives? Even if the number of cases start to fall in the next 3 months, then we will stay be far from the end. It can take a long time for the tide to go out. It is clear the current strategy of shutting down a large part of society is not sustainable in the long term. What countries need is an exit strategy, a way of leaving the restriction and getting back to normal. The best guess is if we have a vaccine, but it could still be 12 to 18 months ago if every goes smoothly. That is some time to wait. So what can we do? We support each other to fight this virus. We have to take care ourselves, our family, include children and elderly. And the last, don't forget to keep clean and wash your hand. Okay. Thank you.
Okay, thank you, ma'am, for your nice answer, and hopefully can add information about home care for older people during the COVID-19. And the last I said, thank you very much, ma'am.
Thank you.
Keynote speaker will be moderated by Edi Marjuang Purba.
Thank you, sir. Thank you for. Thank you. We'll continue. But before we continue, I will check Dr. Ahmed has been here.
Hello.
Hello. Yeah, sir. Welcome.
Thank you very much.
Yeah, welcome, sir. The new staff.
Yes.
Yeah. Ladies and gentlemen, the next speaker, Dr. Ahmed Abubakar Tijani from Kwara State Ministry of Agriculture, Nigeria, and the title, Lesson Learned from the Front Line in Other Countries. Before we start presentation, I'd like to read curriculum vitae of Dr. Abubakar Ahmed. Now, Dr. Abubakar Ahmed Tijani worked at Kwara State Ministry of Agriculture, Nigeria, and he is a veterinary epidemiolog. He has public health knowledge, skill, and experience to efficiently respond to disease outbreak and pandemic. He is highly organized with the international experience and used to the communicating and working in a team environment with the WHO, in the public sector, NGOs, and others to respond to outbreak in complex situations. Dr. Abubakar Ahmed Tijani has many professional experience, including in COVID-19. He has obtained Doctor of Veterinary Medicine from Ahmadu Bello University, ZAHRAH, Diploma Certificate course on surveillance and control of rabies from University of Lausanne, Switzerland, and Master in Public Health focused Veterinary Epidemiology practice from University of Ibadan, Nigeria, Field Epidemiology and Laboratory Training Program, and now ongoing for Master in Disaster Risk Management and Development Study of Ahmadu Bello University, ZAHRAH. Dr. Abubakar Ahmed Tijani has excellent skill and work experience and also association and professional membership. Besides, he has many presentations about outbreak. He has published several research papers and also has some awards, namely Presidential Award for Meritorious Service for Ebola Response, Freetown, Sierra Leone, 2015. And then Global Ebola Response Award, Freetown, Sierra Leone, 2015. And then Full Master Scholarship Award in 2014. And Federal Government Award of Meritorious Undergraduate, 2004. Ladies and gentlemen, I'd like to welcome Dr. Abubakar Ahmed. Now, time is yours.
Thank you very much, Master of the Ceremony, my good friend, Master Eddie. It's a pleasure to be with everyone again. Good morning, everybody.
Good morning, sir.
All the way from Nigeria here. Can you hear me very well?
We can hear.
Very good. So, the COVID-19, the Nigerian experience. As you can see me now, I'm dressed in a bowler hat, dark shade, and mask. This is the new norm. And if you ask me, has COVID-19 changed our way of life? Yes, indeed, it has changed our way of life. So now I'm going to take this off because this is the new norm that we dress in this country now. So good morning, everybody. COVID-19 has indeed changed our life and the way we dress, the way we go out, because we need to stay alive. Currently in my country, Nigeria, you have to dress with your face mask, and if you work in the healthcare setting, we prefer you put on a shield. Can I see my slides, please? Hello?
Okay, please continue, sir.
Okay. So I'll be discussing on the etiology, origin, sign and symptoms, transmission, prevention and control. But basically what we're doing in Nigeria as an experience is what I'll spend most of the time on. So we all know the origin has 75% similarity with SARS from pangolin. And I have a slide here that shows the basic structure of the SARS-CoV-2 that we're currently dealing with the M protein, the envelope, the RNAs, and the N protein. Can you see my slides?
Can you share your slide, sir?
How can I share it, please?
Share screen. please.
How can I do that?
Can you send me by WhatsApp maybe? I will share.
I think I've sent it to you already. I sent you the slide already. Check your WhatsApp. Have you seen it?
Yeah, okay. Wait a moment.
Good, good. Oh, good. Thank you very much then.
Welcome, sir.
So the Nigerian experience. So I'll be going through this outline from the basic of the morphology of the virus in question. Next slide. Let's go to yes. So now the signs, the symptoms of COVID-19. Shortness of breath and sore throats. But as you all know, we're now including things like loss of taste to these symptoms, and it may keep improving. In this part of the country, we've seen some other people start with GI symptoms. So we still have a lot of things to learn about COVID-19. Next slide, please. Okay, so this is just a distribution worldwide, as previous presenters have presented already. We have hello?
Yes.
Next slide, please. Okay, so this is the African experience, with a total case of about 372,000 now. As you can see, it's growing, almost 10,000 deaths, and a recovery of about 179,000 recoveries. The most. Can you hear me? Can you hear me?
Yeah, yes, we can.
Oh, good. So the most affected countries in Africa include South Africa, Nigeria, Ghana, and the northern African countries. Next slide. So we can get to the core of the matter, which is the Nigerian experience. Thank you. So, due to the outbreak of this corona, there has been lockdown, and this is where the whole challenges and experience start from. The COVID-19 pandemic has had devastating effects on the mental health of the people and the economic health of the people. And this to us is one of the biggest challenges we face as a nation. While we are trying on one hand to put COVID-19 in check, there is the economic challenges and there is the security challenges all at the same time. Next slide. As you can see from the timeline of the virus in Nigeria, which started around 27th of February, it has been growing steadily, and we are yet to flatten the curve. You will see with this graph that the outbreak in Nigeria is still growing and probably just about to pick up. One of the issues we've had has been low testing, and a lot of things have been put in place right now, from support from Africa CDC, the Nigeria CDC, and several international organizations. There's been a lot of collaborations and support to ramp up testing. And I think due to the increase in testing, now you can see the earliest stages are on the low side and a bit down. But with ramping up of tests, you can see we're getting more and more cases, and we'll have strategies in place right now to further ramp up these tests. So we hope to pick up more cases until we flatten the curve also. Next slide, please. So this is timeline of the virus, looking at it geographically. It started with from Lagos, and as you can see, it has moved all the way to the corners. We tried several measures like lockdown, and I think what we would say for the lockdown is it gave us time to be able to plan. It didn't really stop the spread, but it slowed it down due to the nature of our weak health system. It has helped, and I think this is responsible for the low mortality we are having. The lockdown helped us to be able to handle the cases gradually without a sudden spread, which will totally overwhelm our weak health system. And this is one of the good things I think we did, we got right, even though we know we could have done better.
Biar mau itu.
Next slide, please.
More.
So, part of the activity we instituted in Nigeria include social gathering. We suspended every form of social gathering in the country. Market days were reduced to once a week in most states. There was interstate border closure. And there was also halt in all public religious activities, and this includes mosques and churches, and all religious places were all on lockdown. Wearing of nose masks every time we were going out became compulsory. As you can see, I wore mine for you to see the standard in my country now. And of course, limited exposure to everything. Next slide, please. Okay, so how do we prevent this outbreak from further spreading? No more visiting of next door neighbors, no more handshakes, no more comfort buying by the roadside vendors, and of course, collecting change from vendors or bosses. Like if you go to buy groceries, we prefer you don't take change, know what you want to buy and give it to them that way, so you avoid change in cash as much as possible. Next slide, please. Okay. So part of the challenges we have faced in our country is one, refusal of quite a number of people to get tested. There has been a lot of resistance to people getting tested. Even when we have the test kit, there's been a lot of myths and rumors, and people have a lot of concerns about getting tested. While we're doing a lot of work in community engagement, we still have a long way to go in battling the myths and rumors that have made it complicated for us to respond to this outbreak. Refusal to also stay in self-isolation upon arrival is another one. Some people are still living in denials. Even when you show them increase in mortality, they may just want to attribute it to other causes. And you will have to start explaining to them the trend from past years for them to see that there's really a spike in the mortality for this year. Non-compliance has also been an issue, and of course, for education of small communities on the realities of this virus. Another challenge is also lack of total documentation. We wouldn't say we've been able to capture every single case, both cases and deaths of corona associated right now. We are really working on expanding the surveillance system to be able to capture every single cases and deaths, but we still have quite a long way to go. Next slide, please. So myths and conspiracy about coronavirus in Nigeria. There has been a lot of issues if you check the internet, Twitter, Facebook, you keep hearing things like coronavirus is a plot to embezzle money by NCDC and government officials. So each time the NCDC gives out a daily CTREP of data, there's always challenges, challenging the figures are inflated, and these are all things that we believe community engagement is needed here. NCDC has done very well in stopping the coronavirus in Nigeria. And I must say at this point in time that Nigeria and Brazil, for example, both had our index case at the same time, February 27. And from then on, NCDC has been able to manage the number of cases and deaths in Nigeria to what we have today. When you compare that to what has happened to countries with better healthcare systems than us, like Brazil, then you will understand the quality, the effectiveness of the measures the NCDC has put in place to curb and halt the spread. It is quite impressive like never before. I wouldn't say we couldn't have done better, but given the resources and challenges the NCDC has had on their hands, I think I will give the NCDC kudos for the good work they have done. We could have done better, but I think relatively, Nigeria, with our population, with our challenges, with our low resource setting and challenges in healthcare system, I think we have relatively done well in managing our COVID-19 cases. And this has to go kudos to NCDC and support from other international partners like Africa CDC. And we are just even beginning to get some other things right. So moving forward, I'm sure we'll soon flatten this curve. Next slide, please. Good. So while the world is in hustle for tissue papers, Nigerians are more worried about not dying of hunger. And this is a reality for resource-challenged settings like Africa, like Nigeria, some countries in Asia also. While you are trying to make people understand the challenges you face with COVID-19, they are only worried about their day-to-day means of income. One of the greatest challenges are those workers who earn their daily means on day-to-day basis, like the taxi drivers, the shopkeepers. Even if they agree with you on this lockdown procedure, they can do nothing about it because they need to go to work to be able to feed their family. Now, the country carried out a very massive palliative measures for the most hard to hit. But for a population of 200 million, there's limit to how long such palliative will last. And this is how you see some of those lockdown procedures are being disobeyed, and that's why you see still having some few cases. So we have challenges with that, but I think we'll still record it as an overall success, given the fact of our challenges. Next slide, please. Okay, so panic and anxiety is another. The scare created with the advent of the virus caused more people to develop insomnia, eating disorders, and even anxiety problems. And I think a lot of work is currently ongoing on the psychosocial stress, the mental health that this COVID-19 has really caused the people of our country. I think globally, a lot of work on psychosocial stress support and mental distress are being done. And I'm sure before this COVID-19 finally wind up, we will see more publications on the overall effect that COVID-19 had on both the economy and the mental well-being of the people of various nations. Next, please. Okay, so in addition to the panic and anxiety attacks, we also have the economic crisis. The advent of this virus has forced small-scale entrepreneurs to close down, like I said earlier, and some companies to lay off their staff. This and many more other problems increase in unemployment and closure of companies, bankruptcy, and companies of establishment. You will agree with me that all these will further exacerbate mental stress on the people of the community. Next slide, please. Next slide, please. Okay, so this is for hospitals in Nigeria and COVID. Now, I wouldn't say our health facilities have been overrun, because I think we still have a manageable size of number of cases. But in some hotspot areas, like places like Lagos, places like Kano, FCT, they have higher number of cases, and I think we're doing well so far. But we have challenges with the quality of health facilities at the lower level, the grassroots, the local government areas. And for us, a lot has been done by the National Primary Health Care to boost the preparedness and readiness of the healthcare workers in these facilities, so that we can reduce hospital-acquired infections to the barest minimum. One thing Nigeria has done very well, and I'll keep giving kudos to, is there was massive training and retraining of healthcare workers. We know our challenges. We know we may not have all the equipment, but in terms of public health response, training of epidemiologists, training of healthcare workers, training and retraining of IPC specialists has been done very well in our country. I think we used what we have to respond to this system. We don't have the best healthcare system. We have challenges, but we have been able to manage our challenges to keep this outbreak at bay. Hopefully, this outbreak will teach us a lot of lessons. like equipping our health facilities in preparation for the next outbreak. The picture you are seeing here is what we are hoping every single health facility in Nigeria will become someday. Next slide, please. Okay, so we also do, in some community, there's what we call community testing. So those you see here are voluntary community tests in some community on the left, and on the right, that's just enough taking the normal triage screening before you enter a health facility. These two things are currently ongoing in my country, and I think these are part of those things we have put in place that has kept our cases on the low. Next slide, please. Okay, so the healthcare system in the country, we will say it's not the best at this moment, but with the advent of this COVID, the loopholes have become obvious, and we hope with increasing support, we'll be able to boost the healthcare system. We also had challenges of lack of availability of PPEs in the beginning, the bed spaces and all sorts, but a lot of things have been done now to boost this availability. Now we have health facilities that produce their own PPEs themselves. They no longer wait for support. They buy the materials, we manufacture in some selected health facilities. And I think these are those things that we have done that has been able to keep the healthcare workers infected to the BRS minimum. And of course, the unavailability of healthcare workers to reduce the patient overload was also addressed by training and retraining of healthcare workers. And I think now Nigeria should be on its way to self-sufficiency. A lot has been done to address the outbreak and make sure our challenges are being addressed one after the other. Next slide, please. So what is the way forward? Number one, there has to be improved testing capacity and testing centers. This, the NCDC has done very well. When this outbreak started, we barely had up to 3 labs that would diagnose COVID SARS-CoV-2 samples. But as we speak, we have over 30, NCDC moved from that to over 30 testing centers now. And for us, the speed with which this was achieved and the quality was unprecedented. And these are part of the achievement of the Nigerian stories. Now our samples no longer have to wait for 5 to 7 days before we get results. We are now getting results between 24 to 48 hours. And this is one of the success stories that Nigeria has, kudos to our NCDC. Increase public awareness and advocacy. A lot is going on, but unfortunately, the rumor mongering, the intense social media campaign against the program probably started way ahead of us. We are doing a lot in terms of public awareness and advocacy, but we are not yet there. A lot is still needed to be done for us to be able to achieve behavioral change for people to truly see what COVID-19 is. Provide palliatives for the masses and support businesses. This is ongoing, but for a country of over 200 million and scarce resources, there's limit to what amount of palliatives will be enough. But these are all going in various economic palliative measures the government is giving out. Continuous IPC trainings and PPE procurement. This is being done excellently by NCDC, supported by African CDC and other international partners like AFNet, WHO, and so on. Vaccination, we have not started this in our country, and this has to be the way forward. We still hope the African CDC is leading a campaign on vaccine manufacturing and procurement. So we're still keeping our fingers crossed to see these happen so we can nip this virus in the bud. Improved contact tracing is also ongoing. There are huge challenges in contact tracing because if you have to contact trace in a community that don't even agree with you that there is COVID-19 in the first instance, then you will have challenges. But the country is doing everything, sending professionals onto the field to go and support state and local government on improved and effective contact tracing. Next slide, please. Okay, so take responsibility for COVID-19. If you must go out, wear your mask, like I addressed in the beginning of this presentation. Wear your mask. If you can protect your eyes, wear your goggles, wash your hands always, and maintain your 2 meters distance apart. Next slide. Okay, next slide too. So these are examples of people that are putting on their nose masks, and these are the places I got my materials from. Thank you very much for your time. It's been a pleasure talking to you all. Thank you very much, everybody. Thank you, thank you, thank you.
Thank you, Dr. Ahmed, for sharing the experience and also knowledge and also the information, so we can compare how about the Indonesia, how in Indonesia and also in Nigeria. The first question from myself, I want to ask you about when you also in the Ebola pandemic in the 1915, and now so occurred the COVID-19 in 2020. So what is the difference? What is the difference of the pandemic? So the Ebola came over, but now still until now the COVID-19 not yet over. What is the difference about that?
Please ask the question again, Sam. I didn't hear it very well. Please ask again.
What is the difference the Ebola pandemic in 2015 and COVID-19 in 2020?
Okay, thank you very much. For me, because I was part of the Ebola response for Lagos while it started in Lagos in Nigeria. And from there, we moved to Liberia to support them, and we also moved to Sierra Leone. I think the difference between these two would be in terms of belief. Most people truly believed there was Ebola, so there was community response. Contact tracing was easy. Nigeria, as an example, everybody in Nigeria believed there was Ebola, and everybody obeyed government directives. Unlike COVID-19, because of the high number of asymptomatic cases, between 50 to 85%, people we have shown them that have come down with COVID-19, but they still look healthy. So it was a very difficult sell for the government to the community when they see you said this disease is very deadly. Here is someone you said is infected and is still very fine, eating well and playing football. So it was difficult for the people to really believe COVID-19 existed. They couldn't differentiate between the 5% severity, 10 to 15% moderate, and the 50 to 85% mild. They could not understand that division. And so the high number of asymptomatic cases made our job very difficult, and this is what's leading to not so effective community belief on a successful engagement for people to totally obey our government directives. I think that's the major difference. Then, of course, Ebola also had a higher case fatality rate. So the case fatality rate for COVID-19 is not scaring them enough. So it was a more difficult buy-in than the Ebola that they know is as high as 40%. So everybody was much more interested in not getting Ebola than they are right now for the COVID-19. I think that's what I think about it. Thank you very much.
Thank you, sir. And so many questions here. The next question from Febriana. How about the nurse service? Nurse service when doing surgery in the operating room for patient with the positive COVID-19. And after the surgery is done, what about all the tools that have been used on COVID patients?
Well, going by the IPC guidelines of the NCDC, there is the equipment cleaning aspect, and most health facilities have been trained on how to clean and disinfect every single hospital equipment that have been used in COVID-19 treatment center. And be it surgery done on COVID-19 patients or just normal procedures that have been done, treatments in the treatment center, we have a very clear procedure on how to clean and disinfect every instrument, medical equipment that have been used to avoid hospital-acquired infection. I think the IPC training and retraining Nigeria has given its healthcare workers, I think it's top-notch. We have experts from NCDC, Africa CDC, still moving from state to state, giving IPC training and retraining. So I think that those are the guidelines we follow, the NCDC guidelines on proper equipment cleaning in COVID-19 treatment centers. Yeah.
Okay, thank you, sir. We have still question from Dwinda Sari. She asks, in some hospitals, there are, the next question from Dwinda Sari, there are overcapacity of service, as well as the unit and health personnel themselves, because the patient increase, as well as until the health personnel themselves. So here the patient will feel afraid of his own condition. This will have an impact on the psychological condition of the patient as well. How do we as the medical team deal with this condition?
Okay, so if I get that question correctly, it's saying a patient going to a hospital that is overwhelmed. Was that a question? I didn't really get that.
So how the personnel in hospital deal to the patient because the room is full.
Okay. Thank you very much. I get that now. So one other thing that has happened in our setting is due to the outbreak, there has been quite a number of changes that were done to several health facilities. I wouldn't say to all, but most health facilities now have what we call triage. So at every point in time, even the OPD sessions don't get filled up anymore. The most people with mild ailments in this outbreak, they have been encouraged to make phone calls instead of going straight to the health facilities. So there has been a lot of phone consultations for what they can address. So most people going to the health facility are going there, those with symptomatic people, those with severe cases, but those whose conditions could be addressed receive phone consultations. And if you even have symptoms, you have been advised to call the NCDC toll line before you proceed to the hospital. So all these have been done to make sure the hospitals are not overwhelmed and not overcrowded. I think these are one of those things we did in Nigeria that has reduced overcrowding in our hospitals and also reduced hospital-acquired infections in Nigeria. Thank you. I hope I addressed that.
Okay, sir. We have the last question.
Okay.
The last question for you from Anna Savitra. She asks how to generate an economic crisis in the era COVID-19.
How to generate economic what?
Economic crisis in the era COVID-19.
Okay, how to generate economic crisis?
Yes.
Okay, is it how to prevent economic crisis? Is that the question?
Yes, that's right.
Oh, okay, so how to prevent economic crisis in this COVID-19 era? Well, this is beyond my scope. I'm not an economist, but what I know I can say in this regard, it just has to be gradual opening of the economy after risk analysis, and of course, when you begin to flatten the curve. But like we've always told everyone that cares to listen, the lives of the people supersede at any point in time any economic benefits. If this crisis rages on, we must plan ways to make people to survive. But thinking of economy when people are dying is a very dicey situation that requires a lot of experts coming together to handle that. I'm afraid I wouldn't be able to speak much on the economic aspect. I'm sorry. Thank you.
Yeah, it's okay because you are not the economic. So
exactly.
How about in Nigeria and we compare to our country in Indonesia. So
exactly.
Thank you very much, Dr. Abubakar, for your explanation. Hopefully,
thank you very much.
Your sharing give benefit for all participants, and we together how to prevent COVID-19 in the world. Thank you so much.
Thank you very much. I'm honored to be here. Thank you, everybody.
Thank you. And the next agenda will moderate by Mr. Zulkarnain.
Okay, thank you. Okay, ladies and gentlemen, for the last agenda, we want to take a photo for all participants. So I think all of us must active video in Zoom, and our commit, we will take a photo for this session.
Untuk semua partisipan, kami untuk sesi terakhir adalah foto. Jadi berikan senyuman terbaikmu akan diambil oleh operator. Oke.
Okay, ladies and gentlemen, I would like to thank all the speakers who have shared and given many knowledge, and also to the audience for their time. It has been a pleasure being with all of you today. And see you tomorrow at 8 o'clock. And the last I say, thank you, and thank you very much. See you again tomorrow.
Okay, see you again tomorrow, sir.
Good
Thank you.
afternoon, everyone.
Thank you. Thank you.
Thank you. Selamat Abubakar. Thank you for Nigeria.
Thank you, sir.
Thank you, sir. Thank you, ma'am.
Sir.
Good
Thank
afternoon.
you.
Thank you for
Ma'am.
Ahmed Abubakar.
Thank you, sir. Very much.
Can we leave, sir?
Before we leave the Zoom, we can see the profile of Stikes Mitra Husada Medan. So we invite you to join with us in Stikes Mitra Husada Medan, the College Standard International. Thank you.
Thank you, Sir Eddie and Sir Zulkarnain, Master Ceremony today.
My name is ZAHRAH. I come from NES Iceland, and don't forget I'm second semester. Well, I will introduce my campus. Why I choose in this campus? Because in this campus so very clean, and then there are 6 buildings such as clinic, ANC, INC, mosque, and laboratorium, English and computer. In laboratorium English has earphone, computer, and internet.
To start to external bimanual compression.
Action. Goals: stimulate development baby's brain with stimulate the brain nerves in the big 2 area. So much action. Goal: keep our digestive system helps with directing the hand toward the big intestine, so gas in the stomach is removed. Action. The first action, moon and sun, and the second action, I love.
Ini lagi ngapain nih, Bu? Nggak tahu orang ini lagi.
Program. The first program midwifery affiliate bachelor midwife professional program, professional education midwife professional program, midwifery diploma program, and nursing diploma program.
I'm so grateful to study in here because in this campus I can learn many things because Mitra Husada Medan is the best of health college in North Sumatra.
My name is Mitra Husada. I'm second semester and from Bachelor of Midwifery. Choose in here because one of the reason is in our dormitory has many facilities.
My name is Febriana. I'm from Diploma Midwifery program. Here I want to share about my experience in dormitory. Here we can learn how to talk, how to learn, how to eat well, and how to use uniform.
We like teacher,